Good morning, everyone, and Happy New Year to everyone. I hope everyone had a safe and good holiday and a quieter one, I know, but hopefully we'll have a new year that we can move on with a lot of hope. I'd like to call the Board of County Commissioners to order, and first off, we will have the invocation, excuse me, and pledge by our chaplain, Commissioner Stacy White. Commissioner White, you're recognized.
Thank you, Madam Chair. I'll ask everyone to stand if you're able. We'll begin with the Pledge of Allegiance. Attention, salute, pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Heavenly Father, I pray that you will guide this board, our staff and stakeholders as we make important decisions this morning. I ask for your blessings as we kick off this new year. I hope we have a healthy and productive new year. As always, Lord, I pray for our first responders and members of our armed forces who continue to work tirelessly in many cases on this COVID-19 response. And we just pray, Lord, that you will help us usher out this virus, turn the page on a new chapter in this new year. I ask for all of these blessings in your heavenly name. Amen.
Thank you, Commissioner White. And now if we can have a roll call to establish quorum.
Kemp.
Here.
Overman.
Here.
Smith.
Here.
Cohen.
Here.
Hagan.
Here.
Myers. Here. White.
Here.
Thank you. You have a quorum.
Thank you. So we will present one recognition today. The recipient is joining the meeting virtually, and the recognition will be presented by Commissioner Overman. Commissioner Overman?
Thank you, Chair. I really, truly appreciate that. And Happy New Year to everyone. I am very thrilled to do the proclamation declaring January 2021 as Human Trafficking Awareness Month in Hillsborough County. Is Natasha Nascimento here? She's present. I see you. Thank you for joining us today. I appreciate that. She is the Chief Executive Officer of Redefining Refuge, and one of our great partners in the effort to address human trafficking. Every year, Hillsborough County has been steadfast in its efforts to combat and win the war against human trafficking. This is an issue I'm deeply passionate about, and as a county commissioner and a member of the county's Commission on Human Trafficking, we are joined today on the call by a number of our fellow commission members who I would like to recognize and thank for their anti-human trafficking efforts. We have on the call today Public Defender Julian Holt, Mr. Santiago Carrada, Ms. Jennifer Glaser, Ms. Dottie Grover Skipper, Ms. Connie Rose, Captain Rob Staley, and Ms. Chantal Quintana on behalf of Ms. Kathleen Kempe, who's with the Crisis Center of Tampa Bay. Redefining Refuge and our other community partners have worked tirelessly with the brave survivors of this terrible crime to recover and move forward in their lives. We would like to recognize in particularly the incredible work our Survivor Advisory Committee, the members which have worked very hard to ensure our work is always survivor informed. As we get close to the Super Bowl 55, which will be played in our backyard, Hillsborough County will continue to raise awareness through its Don't Buy It digital and social media campaigns. I'm proud to present this proclamation to Ms. I'm going to mess it up. I'm so sorry. I do every single time, but Nacimiento and Redefining Refuge declaring January 2021 as Human Trafficking Awareness Day. And before I leave and read the proclamation, I also want to make you aware that today at the airport, our Attorney General is announcing the communications plan with the airport with it's a penalty. I believe it is at 1 o'clock or early this afternoon. The campaign to make sure that visitors coming into Hillsborough County and the Tampa Bay region are aware of our efforts to fight human trafficking. So the proclamation reads, whereas, according to the International Labor Organization 2017 report, 24.9 million people were impacted by human trafficking worldwide, where 16 million were exploited for labor, 4.8 million were sexually exploited, and 4.1 million were exploited in the state-imposed forced labor. And whereas globally, women account for 56% of the known human trafficking victims, and children account for another 31%, according to the Counter Trafficking Data Collective. And whereas in order to trap vulnerable individuals, human traffickers use a variety of abhorrent methods, including violence, drugs, and manipulation. And whereas the National Human Trafficking Resource Center, Florida ranks 3rd in the nation for the number of calls to the National Human Trafficking Hotline. And the Tampa Bay area serves as a hub for trafficking. And whereas the Florida legislature continues to work diligently to ensure the safety and ongoing care for victims and survivors of human trafficking. And whereas Redefining Refuge, a nonprofit organization, has dedicated itself to advocate for women and children who have been victims of sexual abuse, in addition to abolishing the domestic sex trafficking of minors. And whereas in partnership with Hillsborough County, Redefining Refuge continues its steadfast mission to increase public awareness of the sex industry trade and its eradication, and to vindicate every individual from the atrocities they have experienced so they may become victors and not victims. Now, therefore, be proclaimed that the Board of County Commissions of Hillsborough County does hereby declare January 2021 as Human Trafficking Awareness Month in Hillsborough County, and encourages all residents and visitors to be vigilant in identifying and reporting human trafficking, to send a strong message that Florida will not tolerate any form of slavery. Executed this 6th day of January 2021. We're going to have fun making that transition this year, but glad 2021 is here. Signed by all 7 commissioners. Ms. Dosamantia, I'm going to mess it up. Would you like to say a few words?
Yes, thank you so much. Again, Commissioner Overman, and special thank you to Dr. Heather Curry and Jennifer Glaister as well for just your continued commitment to this cause. A proclamation to me is a symbol of recognition and also a symbol of commitment, commitment to freedom more specifically. And when I was first asked to accept the proclamation, I immediately thought of the Emancipation Proclamation, which we know was drafted over 150 years ago. And in this proclamation, it mandated that the oppressed would be liberated and that they would go on to become liberators themselves. And so to me, this is not just a human trafficking proclamation, but it is Tampa's Emancipation Proclamation. It is a symbol of our commitment as a community to this cause. It is a symbol of our recognition of those that have been impacted by this. And it's also our way of saying that trafficking of children and young adults will not be tolerated in our community. It's been an honor for Redefining Refuge to serve our community in this capacity over the last decade. And we are very hopeful that in the near future, we can proudly say that trafficking does not happen in Tampa Bay. Thank you.
Thank you, Ms. Nascimento. I'll get it right. I'll get it right. And I do want to thank all of our commission members. The amount of work, body of work that we've been able to accomplish in the last year is amazing. So, which is testament to the amazing participation and commitment our community has to supporting those that have been impacted by human trafficking and to eliminate this crime in our community. And I just want to thank everyone for their hard work this year. And we have more to do, but thank you very much for being here today. Jerry, the floor is yours.
Is there? Sorry. Trying to repair. So thank you so much for that presentation. I want to thank Ms. Nascimento for joining us today and for everything that you've done for your work in Hillsborough County. Thank you.
Thank you.
And now we'll move Ms. Wise. Any changes to the agenda?
And Happy New Year, board members. We have a few items for time certain today. At 10 a.m., we have item E1, the emergency management operations related to COVID-19 and the local state of emergency. At 10 o'clock, item G1 is to receive a report regarding an update on COVID-19 programs and activities. At 10:30, item E2 is a special appearance by Julian MacKenzie, President and Chief Executive Officer of MOSI. And that is all. Those are the changes to the agenda.
Thank you. Do we have a motion?
Move the changes. Move the changes.
Second.
A second? Okay. We have a motion by Commissioner Overman, seconded by Commissioner Smith. Can we please have a roll call?
Kemp,
Yes.
Overman,
Yes.
Smith,
Yes.
Cohen,
Yes.
Hagan, Myers,
Yes.
White.
Yes.
Motion carries.
Great. Thank you so much. We'll now move to public comments. And the board welcomes public comments from citizens about any issue or concern. Your opinions are valued in terms of providing input to board members. However, it is requested at the same time when you address board members that comments are not directed personally against a commissioner or a staff member, but rather directed at the issues. This provides a mutual respect between board members and the public. The board has set aside a 45-minute period in the morning immediately following changes to the agenda for public comments. At the discretion of the chair, the board may again hear public comments at the end of the meeting. Anyone who wishes to speak during the meeting will be able to do so by completing the online public comment form found at Hillsborough County /speakup. You will be required to provide your name and telephone number on the online form. This information is being requested to facilitate the audio conferencing process. The chair will call on speakers by name in order that in which they have completed the public comment form. Prioritization is on a first come, first served basis. An audio call-in number will be provided to participants that have completed the form after it's received by the county. All callers will be muted upon calling and will be unmuted in the submission order after being recognized by the chair by name. Up to 3 minutes are allowed for each public speaker. Citizens speaking on scheduled agenda items will be heard before citizens speaking on non-scheduled agenda items. When addressing the board, please state your name. And our first speaker this morning is Noelle LaCour. Is Ms. LaCour present?
No, Commissioner, she is not.
Okay. And we'll move to Brian Myers.
Yes, ma'am. Thank you very much. And
I want to give a special thanks to the commissioners for their proclamation. I think as a resident, I'm very proud that our county is looking at trafficking as a vulnerable issue, and I, again, give my sincere appreciation to the board. I come with a little bit of a different agenda here. I am a resident of the Wilson Preserve here in Riverview. I've been a resident for previously about 7 years, and my statement is pretty much concerning the PACE program through Y-Green. I became aware of the solar power issue and pretty much hit home base back when Hurricane Irma hit the county. I have a backyard pond that I built, and I raise koi fish. And when the hurricane came through, it just about devastated my community. We were without power here for about 4 or 5 days, and it killed. Because of that, I really wasn't worried about losing my power to my refrigerator, my air conditioner, and everything else. But man, when the power knocked out the plumbing or the tanks to my pond, when I started seeing my koi fish die, that kind of hit home base because my fish are like my little babies. In any event, I have been a banker my entire life, banking administration, and so money is very important to me. And I had researched actually through an article that Governor Scott had presented through various channels about solar panel and this program called the PACE program. And I thought, after going through that tragedy of the hurricane, I realized that I got to get with the 21st century. I got to look into solar power. And I knew it was going to be a costly venture. My home was rather new, but builders today sometimes will look at the easiest way to build a home, sell it, and get out and go to the next one. And I had engaged in solar. I contacted several solar companies to come out, take a look at the solar, the provisions to getting solar. They gave me various prices and various opinions. I finally made my decision as to what solar company I was going to use. And with that then came the financing option. Well, each solar company had a financing option available. And again, being a banker, I am one that really gets involved with financing.
The time is up.
Yes. I'm sorry, sir, your time is up. I guess we'll go to the next speaker. Thank you for your comments. Anna Vakula Ja.
Yes, I'm here.
Yes, you're recognized.
Okay, thank you. My name is Anna Boone, and I live in Brandon, Florida. In the middle of hot Florida summer of 2018, my AC system broke down. Immediately, I called my contractor, who informed me that the old AC system I had was broken and it had to be replaced. I was very nervous about the cost of new AC, as the prices can range anywhere between $6,000 to $10,000. Just like most other families, me and my family were not financially ready to make such large purchase. My contractor then told me about a new financing program that was recently introduced in Hillsborough County that was called PACE by Y-Green. He told me some basic information, and I got in touch with Y-Green customer service representatives who explained all the terms and the conditions of this program in a very clear manner. Y-Green is so easy to reach, and they're always willing to assist me when I have any questions. Within minutes, I was approved, and a brand new AC unit was installed by my contractor the very next day. Y-Green did make it so easy, and there are no surprises with the financing each month or the bill. Now, this program really is a great fit for my budget-conscious family, and another benefit is that I'm also saving money on my monthly energy bill, I can honestly say that conservatively, each month I'm saving anywhere between 10 to 15% on my electric bill. I am aware that the county is possibly wanting to discontinue this program, but I can tell you from my personal experience that this program is very much needed here in hot Florida and such a great financing option for families and individuals like me. AC systems are so expensive, and Y-Green is budget-friendly and smart choice for Hillsborough County. Thank you.
Thank you. Next speaker, Donna Hills.
Hi, can you hear me?
Yes.
Okay, thank you. My name is Donnie Hills. I live in Ruskin, Florida. I'm a special education teacher and a financial advisor. We were having air conditioning issues, and it was very expensive and costly to us also. Our air conditioner was constantly running and eventually stopped working. In an effort to be financially responsible and replace our AC unit, we looked at multiple options, and we ran into Y-Green. Y-Green was the right financial choice for our family, especially being a financial advisor. Again, we wanted to make sure we didn't get over our heads into debt, that we didn't put ourselves in a position that it would strain our budget or we overextended ourselves. Once I spoke to my contractor and they introduced me to Y-Green, I spoke to the representative, and the process was smooth, flawless, and of course, very informative. And as an educator, I really appreciated the education throughout the process because this was something new and unfamiliar to me. I was instructed several times, 2 or 3 times by Y-Green on the process and how it operated, and was asked several times if I had questions. This I love specifically. We experienced significant savings also through the replacement of our air conditioner during the summer. Our bills would be over $300 a month because of our air conditioning. Now we're in the 200s. I like Y-Green in this program because there's no surprises. It's predictable. We pay $78 a month. It's affordable and convenient and consistent more than anything. Y-Green and the program made me feel safe in that I was not left alone with the contractor just to, solve the situations between myself, but I was asked throughout the process by Y-Green if I was satisfied with the work of the contractors. And I was also told that they would not release funds to the contractor until I was completely satisfied and they had completed all the adjustments that needed to be done. For us, Y-Green was a no-brainer. From that point, we're not talking about something that's a giveaway, but we're talking about accessibility to other financial options. Why would anyone narrow the lane for this resource? I don't know. Why would anyone be less than thoughtful and generous as well as prudent in giving access to something that is so fundamental? We're not talking about adding a swimming pool or a second story to our house. We're talking about having the availability to have our house cooled and heated, especially during the summer months. Using Y-Green for our families was just the right choice, especially because it was simple and clear. And as an educator, I appreciated having that.
Your time is up. I'm sorry, excuse me, your time is up. We can move to the next speaker. Jason Kimber, please.
Good morning. My name is Jason Kimber. I'm a business owner, ordained minister of a church, New Vision Spiritual Center. I live in Tampa. Our building is in Ruskin. We do community outreach. I do physical therapy for elderly people and people with Parkinson's conditions. We recently purchased a church building, and it needed a new air conditioning system, and we utilized the Y-Green PACE program to replace our HVAC to help complete the renovation of our church in order to make it ready for our business and for our congregation and outreach. I just wanted to say that we had an amazing experience throughout like the previous caller, they explained everything step by step for us. They vetted the contractors to make sure that there was nothing shady going on. They walked me through the entire process step by step, helped me even troubleshoot, helped me find a new contractor when the first contractor that I picked could not commit to the project. And being a business owner, especially during this COVID pandemic, I'm speaking to the commercial side of the PACE Y-Green program. This is an amazing resource for businesses to, as a revenue, or not a revenue stream, but a way to save money, and also for businesses that are unable to come up with a large sum of money. I mean, my air conditioner system, it was $18,000. And right now, a lot of businesses don't have that kind of funding to throw toward renovations and improvements. And, you know, they explained the low interest loan, that it would be a line item added to our property taxes. They explained everything step by step by step. So I knew what I was walking into when they approved us for the funding. I'm representing Y-Green PACE today. I just felt when I found out they're unable to do business in, or possibly being rescinded in Hillsborough County, because I am actually wanting to use Y-Green again, because they've helped me so much with my air conditioning and with the energy efficiency. I wanted to use the program again to do a project for the windows and the door, energy efficient windows and hurricane doors, so I can continue to finish the renovation of our church building. And I just want to say that it would be a shame if Y-Green and the PACE program is rescinded in Hillsborough County, because this program has not only helped a lot of people, but it really helped us
your
too.
time is up, sir. Sir, your time is up. I'm sorry. We'll go to the next speaker, Amy Elliott.
Madam Chair, Amy is not on the line. We have the only two speakers that are left are Mary Wells and Gerald White, who are on the line right now.
Okay, thank you. Mary Wells, please.
Yes, my name is Mary Wells. I'm a retired speech and language therapist. I'm speaking about the mask mandate, particularly for children. I request that you do research on effects physically and psychologically on children. After months of enforcement, there is a German study of parents reporting over 60% negative effects on their children. Another report says that 93% of adults testing positive for COVID said, I wore a mask all the time. A website that I found for children with breathing disorders states in common sense that children need more oxygen than adults. And they take more breaths per minute. They have smaller lungs and breathing capacities. And they have much more physical activity than adults. A parent of a 6-year-old girl told me that because her daughter had asthma and allergies, she asked the teacher if she could be free from wearing a mask on the playground. And the teacher said no, because the children can't social distance on the playground outside. I think this is a misinterpretation of your order for the county. Also, please check the CDC and America's frontline doctors. The recovery rates for children getting COVID is 99.9%. And initially, the CDC did not recommend masks for children because they're least likely to get it and most likely to recover the quickest. So please check the statistics in Hillsborough County for cases and rates of recovery. The virus is a very tiny molecule compared to openings in the fibers of masks. It is like comparing sand being thrown through a chain link fence. If you can smell smoke, then the virus is getting through. Children are wearing many different kinds of masks made of different kinds of materials, which may be harmful and not replaced or washed daily. Did you know that slaves had to wear masks? It was a symbol that they did not have a voice. And Okay, there's another report that 88% of Americans are wearing masks, yet the numbers are greater than ever for the cases, is what they're saying. So either the masks don't work or the numbers are fake. So I'm just asking you to check all this on behalf of the children who don't have a voice here, and I feel very badly for them having to wear these masks. Okay, thank you for your time.
Thank you. And I'll recognize Gerald White.
Good morning, Commissioner. At Camp Gerald White, Hillsborough County community activist. First, I'd like to say Happy New Year to all the commissioners and voice this very troubling concern with this COVID-19 rollout here in Hillsborough County. I'm very upset. My wife and I spent hours trying to get on this site to enroll my mother-in-law, who's 84 years of age and has been a registered voter here in Hillsborough County for over 60 years. The company that the county hired to roll this program out and do the phone intake needs to be fired immediately. They do not have the public support. They definitely don't have my support on this absolutely unequivocal failure over the last couple of days trying to call in. I don't like the way the program is set up. I think it's a serious disadvantage to the African-American citizens in Hillsborough County. You're talking about, over 1 million citizens that are over 65, and the black population in Hillsborough County is only 15%. And if you look at 2,000 calls a minute, it's just impossible for an African-American to get through. So if we're a high-risk population for this COVID-19, and we're a very small percentage of the population out of over the millions of citizens in Hillsborough County, the black people are not going to get through. This program adversely affecting black folks getting the appointments for the COVID-19 shots. We need something fairer. I would like to see the county commissioners distribute the vaccine by commissioner districts, and that way you'll make sure you cover all portions and all populations in each district in Hillsborough County. We need something more fair, closer to the people, closer to the Hispanic community, African American community, so we can make sure we get on board and get these shots. Because what the governor has planned and what the county has rolled out is not working for the black people in Hillsborough County. I'm not happy, and it's definitely not working for any of the citizens. So we need to open up a dashboard and take all citizens' ideas and get going with this program in a more efficient, effective way. Hillsborough County government has always been on the ball, but on this regard, the county has fallen way short. We need more. Thank you, Madam Chair.
Thank you. And I'll just ask, we don't have any more speakers at this time. Is that accurate, Mr. Brewer?
Madam Chair, this is Glenn with HTV. That is correct.
Okay, great. Thank you. Okay, we'll move to the consent agenda at this time. Do we have a motion to approve the consent agenda?
So moved.
Second.
Okay. Motion by Commissioner Smith, seconded by Commissioner Overman. Seeing no discussion, can we take a roll call vote?
Kemp,
Yes.
Overman,
Yes.
Smith,
Yes.
Cohen,
Yes.
Hagan, Myers,
Yes.
White.
Yes.
Motion carried 7-0.
Great, thank you. And we will move on to the main agenda at this time. Ms. Wise.
Thank you, Madam Chair. Yes, we will move to the regular agenda. The first item is B1. Mary Helen Ferris from the County Attorney's Office will present this item, as well as item B2.
B1 is an item seeking the approval of the issuance by the Housing Finance Authority of Hillsborough County of mortgage revenue bonds in amount not to exceed $6 million for the purpose of construction and equipping of La Estancia apartments. It's an 84-unit multifamily rental housing facilities for persons of moderate, middle, or lesser income. The development will be located at 5292 Guadalupe Boulevard in Waimama and will be initially owned and operated by La Estancia Limited. Again, this is for affordable housing and there are no county funds involved, and I'm available for any questions that you may have.
Move approval.
Second.
We have a motion to approve, okay, by Commissioner Overman, seconded by Commissioner Smith. I see no hands up, no discussion. Can we please have a roll call vote?
Kemp,
Yes.
Overman,
Yes.
Smith.
Yes.
Was that a yes, Commissioner? Is that a yes, Commissioner?
Yes.
Thank you. Cohen,
Yes.
Hagan,
Yes.
Myers,
Yes.
White.
Yes.
Motion carried 7-0.
Thank you. Ms. Wise?
Next item is item B2, another Housing Finance Authority item. Mary Helen Ferris will present this as well.
Yes, thank you. Mary Helen Ferris with the County Attorney's Office. This multifamily project is for an amount not to exceed $11,500,000 for the purpose of constructing and equipping the Arbors at Valhalla Pond, an approximately 96-unit multifamily rental housing for income-eligible people. Development is located on approximately 5.9-acre site on the east side of Robert Toll Drive, approximately 1,900 feet north of the intersection of Robert Toll Drive and Bloomingdale Avenue. This site is basically off of Bloomingdale Avenue and east of US 301. And again, there's no county funds involved in this multifamily affordable housing project.
Move approval.
Thank you.
Second.
Okay, Commissioner Overman with a motion. Commissioner Smith is our second. Seeing no further discussion, can we have a roll call vote?
Kemp,
Yes.
Overman,
Yes.
Smith,
Yes.
Cohen,
Yes.
Hagan,
Yes.
Myers,
Yes.
White.
Yes.
Motion carried 7-0.
So much.
Ms. Wise?
Is item B3. This is to adopt the proposed 2021 Hillsborough County State Legislative Program, and Jim Taylor with Government Relations and Strategic Services will go through this item with you.
Good morning, Commissioners. Jim Taylor, your Government Relations Division Director. As Ms. Wise just said, this is to adopt our 2021 state legislative program. First off, thank you so much for all the commissioners for helping us work with you for your program, as well as the directors and Ms. Wise's executive team. It was definitely a collaborative effort for all these items on the program, and especially with the holidays. It was very hard with our calendar, so thank you, all the commissioners with your flexibility. Two items I just want to bring to your attention, just two minor edits to the program. We emailed it yesterday to your offices, but one has to do with the short-term residential treatment beds and the funding request. Jean Early is still speaking with the Central Florida Behavioral Health Network. Same thing we dealt with last year. It's just more of a strategic effort of who's going to ask for the funds. So either we will ask for the funds that will go towards the beds, or we will support their efforts to receive state funds. And some of those beds, of course, will come to Hillsborough County. And the other one is just tightening our language regarding the welfare system and foster children item that we have on there. We're working with Ramin Shop as well as Commissioner Overman specifically on that item. With that, happy to answer any questions. If not, I seek your approval. Thank you.
Thank you. I see Commissioner Overman, you're recognized.
Thank you. And I just want to briefly state how much I appreciate working with Jim Taylor and as well as obviously the rest of the commissioners on the critical efforts that are most important to Hillsborough County residents. And, just this period of COVID has really shown where we have some holes in our mission. And that's been represented in this legislative platform. And I just wanted to say thank you and move approval.
Thank you. We have a motion to approve. Do we have a second?
Second.
Okay. And Commissioner Cohen, you're recognized.
Thank you very much. I'm going to support this item, but I just want to say something about, it's always really troubled me that local governments and constitutional officers and cities and municipalities across this state all have to spend money to lobby our legislature. It is such an inefficient use of resources statewide. It is unbelievable what goes on in Tallahassee with the number of people that are up there lobbying for local governments who should be able to get their needs met without having to pay outside consultants to do it. I understand we have to do this. I think it's a marvelous program and we need these things. But as a state, it is just, it's just unbelievable that we have a system like this. And I just wanted to say that before we vote on the item.
Okay, thank you for your comments. And seeing no other hands up, we have a motion to approve by Commissioner Overman, seconded by Commissioner Smith. Can we have a roll call vote?
Kemp,
Yes.
Overman,
Yes.
Smith,
Yes.
Cohen,
Yes.
Hagan,
Yes.
Myers,
Yes.
White.
Yes.
Motion carried 7-0.
Thank you. Ms. Wise.
Our final item is item B4. This is for construction and renovation work at facilities and sites throughout county. And Scott Stromer with Procurement Services will present this item.
Good morning, Scott Stromer, Procurement Services. Item B4 is asking the board to award and execute 2-year agreements with the 3 lowest responsible bidders: Gulf American Construction and Development Corporation, Commercial Interiors Incorporated, and New Vista Builders Group, LLC, in the amounts of $8 million, $6 million, and $4 million respectively for ongoing and as-needed moderately complex construction and renovation work throughout the county for the Capital Programs Department. These contracts are used for projects such as fire station renovations, library renovations, parks expansion, and upgrades to government facilities. The resulting agreements provide the ability to bundle projects and secure pricing using predefined pricing factors, which streamlines the service delivery. A disadvantaged business enterprise participation goal of 10% was established for the projects, and all 3 recommended vendors have committed to achieving the goal. Additionally, one of the recommended vendors, Commercial Interiors Incorporated, is a certified Hillsborough County disadvantaged business enterprise. Procurement Services does recommend approval.
Move the item.
Motion to approve by Commissioner Smith. Do we have a second?
Second by Commissioner
Commissioner Myers, I see no hands up, no discussion. So can we have a roll call vote?
Kemp,
Yes.
Overman,
Yes.
Smith,
Yes.
Cohen,
Yes.
Hagan, Myers,
Yes.
White.
Yes.
Motion carried 7-0.
Thank you. And Ms. Wise.
Thank you, Madam Chair. Those are all of our regular agenda items. The only items we have remaining are time certain items. The first one is 10 o'clock. I believe everybody is on the line if you choose to waive your rules and do that early. Otherwise, we'll need to break until 10 a.m.
Break the rules.
Second.
Okay, so we have a motion to waive the rules by Commissioner Overman, seconded by Commissioner Smith. Seeing no further discussion, can we have a roll call vote?
Kemp,
Yes?
Overman,
Yes.
Smith,
Yes.
Cohen,
Yes.
Hagan,
Yes.
Myers,
Yes.
White.
Yes.
Motion carried 7-0.
Thank you. Ms. Wise?
Thank you. So the next item is item E1, which is the emergency management and operations related to COVID-19 in the local state of emergency. We know that you have had many calls and concerns, emails, and we've had speakers about the vaccine. We will address that in part of our presentation. So first, what we'd like to do is have Tim Dudley give the update as he does for COVID-19, and Dr. Holt give his update, and Kevin Wagner as well. Then we will have a discussion about the vaccine. Greg Horwoodell will give some presentation items, as well as Dr. Holt and Tim Dudley. And then we'll go on to the county attorney update for the extension of the emergency order. So with that, I'd like to turn it over to Tim Dudley to begin the presentation.
Good morning, commissioners. All right. Last week, Hillsborough County averaged a little over 1,600 daily test collections, up 52% from the previous week. As you can see here, we are seeing a tremendous interest in continuing testing here in the community. We still have our ambulance mobile testing teams in South and East Hillsborough County at this time. That gave us an additional capacity of 3,000 tests per week. We see a steady demand at the Lee Davis site. They're averaging above 500 tests per day at those sites as well. So we'll continue to maintain those operations as well moving forward. The state testing site at Raymond James Stadium has temporarily moved, relocating southwest of their previous location, just on the other side of Dale Mabry. And this is in preparation for Super Bowl, a huge event that'll be here this coming February. So we continue planning with the city of Tampa and the state to ensure that we can continue to provide that resource for our community. And we'll be looking at between mid-February and March to relocate the testing site back at the main Raymond James site. At this time, we have no logistics issues. We are still serving 8 guests at our isolation sites at this time. We continue to see great support from our community partners with community testing. It has certainly been a great partnership, offering various solutions for our citizens to receive testing. And we see a 2-day turnaround in testing. So testing and the rate of return are continue to hold in a positive direction. And that concludes my update for COVID-19 county testing sites.
Thank you. We going to move to Ms. Wise? Are we moving to Dr. Holt, or how are we moving at this point?
Yes, Dr. Holt, please.
Good morning, Madam Chair and Commissioners. This is Dr. Doug Holt, Florida Department of Health. I will provide the EPI and healthcare overview. And as usual, Mr. Wagner will then walk through our dashboard and will be available for any questions. So if I could have the first slide, please. I think we're all familiar. This slide really shows over time the amount of virus infections that we are reporting daily and cumulatively on a 7-day average per 100,000. We are now exceeding 55 per 100,000. As you can see, that's double the floor of the red zone, and it translates into 800 cases per day on the 7-day average. Our positivity is 15.7%. Really, both of these exceed or are at the same levels of our peaks that we saw on the 1st of July. This is the same situation that the entire state finds itself in, and certainly the Tampa Bay region. We're seeing cases that are increasing across all ages, including our over 65. So essentially, we are seeing infections pretty much everywhere, and a lot of them. So all our eyes now are naturally focused on our healthcare systems and how they are meeting or managing both the demand of their COVID patients and continuing the services to meet the needs of the entire community. As I think we'll show, the bottom line is all of our hospitals are strained collectively, with some more than others. We are blessed to have so many hospitals and resources and outstanding medical facilities, and that they are fully united to meet this challenge. Daily admissions are now averaging 55 a day, which is a significant increase over the last week, approaching our peak of 60 in July. Daily cases have increased 20% in the past week, and we are at 400 average census collectively across the hospitals, approaching our peak of 444. This also indicates, because the hospitals had gotten very good at managing patients and having turnover, this rise in census suggests that patients are both sicker and staying longer. Our bed and ICU capacity are reported at 70 to 80% respectively. This is somewhat misleading because if you look at individual hospitals, you'll see some are exceeding 90% in their ICU. And again, limited staffing is their primary concern. They are managing, but they certainly are concerned with what's ahead. With that, I'd like to transition to Mr. Wagner.
Good morning, Commissioners. Kevin Wagner, Business Analyst, Hillsborough County Healthcare Services Department. As indicated by the County Administrator, I will present the publicly available dashboard off the Hillsborough County's websites. So to date, as of yesterday's update, there are a confirmed 81,105 total cases of residents and citizens who have been diagnosed with COVID-19. 60,594 is the estimated recovered based upon the math. So again, that is, a good recovery rate, but again, the numbers have increased. With regard to the 7 and 14-day change in percentages, as indicated by Dr. Holt, we are seeing an increase. When we look at the 7-day change of confirmed cases from one 7-day period to the next 7-day period, it's nearly a 35% increase. When we spread that out over a 14-day look, it's a 6% increase, nearly a 6% increase. So again, really within the last 7 days of the current cycle, we've seen a significant uptake. With regard to testing on a 14-day average, this past 14-day cycle slipped a little bit to under 40,000 tests completed on a 14-day cycle, but testing, as I'll show later, has increased over the last month or so. That matches Mr. Dudley's presentation. And the 14-day positivity rate is nearly 12.8%, as outlined by Dr. Holt. The hospitalization information on the bottom row, we've updated the data source through a data link through Health and Human Services. That's updated weekly, so there's going to be a little lag with the data because it's a weekly update, but it does fall in line with the indications by Dr. Holt. The hospital occupancy is nearly 70-80% in the hospital and ICU. With regard to the case summary, I'll speak to the bottom line. This is looking over the last 4 months is how we present this on a 4-month cycle. Where we were on the far left in September, really 169 to 190 cases on a 7 and 14-day cycle, to where the slope is now in January, nearly 800 cases on a 7-day average, or 700 cases on a 14-day average. So we do see that slope increase respectfully. This particular page is focusing on hospitalization. Again, speaking to the bottom two charts, we see a significant number in August. July was our peak. We went down in September and October, and the trends upward for November and December with regard to the census and admissions. So again, indicating what Dr. Holt said, it's 55. This dashboard is 65 daily admissions. Again, it's just the timing of the weekly update versus the daily information available. But again, that is where we are looking at the admissions. With regard to testing, as indicated earlier, again, speaking to the bottom row, looking at testing on the far right-hand side from November 2020 to essentially last week, we see that testing has increased significantly. There's been an interest in testing, again, over 40,000 tests per week on the last 5 weeks. Again, last week was just under 38,000 tests. But again, the testing has been strong because of the current demand. But unfortunately, the positivity rate, as indicated earlier, is 12.8%. On a 14-day look, it's nearly 15.4% positivity rate on a 7-day look with regard to the testing. The ages by age group as requested by the board. The top row is the daily cases by age, so there is variability, very much so. But the bottom row is where we look at the 7-day case total per 100,000 by age group. So this allows us to smoothing for trending analysis. And if we look again on the far left-hand side of the bottom row, the respective age groups from 0 to 4 to 18 to 24 were at certain numbers. As we look to the far right of December 27th and to January, we see the slope increase in all age groups. Again, that's mirrors what Dr. Holtzen indicated, that's in the community spread. But by specific age groups as requested by the board, we align this for trending analysis. And I'll stop there. Thank you.
To transition, unless the board has any questions regarding that part of the.
Question.
Okay, thank you.
Yeah, Dr. Holt, 2 things. First of all, I was hoping we could ask that you stay on so that you're here during the vaccine discussion as well. But my question is about the hospitalization data that we just saw. What does the trajectory tell you? You're looking at it, we're at about, it looked like about 70% hospital capacity. Given the number of cases and given where we are, given your knowledge of the number of beds and facilities that we have available, what are you forecasting for the next 3 or 4 weeks in terms of the hospital capacity situation based on what you're seeing?
Yes, sir. Thank you. And I know Dr. Michael had presented something a few weeks back, and they use a lot more science, but I'll give you my gut instinct. We will see more and more patients of COVID needing to be admitted, but the hospitals will respond. They have surge plans, they have other things. What that could entail would be to slow down or selectively not do elective procedures and other things, so they can maintain their operations. So we may see that their capacity stays at 99, 100% or below 100%, but that doesn't mean that they are operating normally. And so it is, the hospitals have done an amazing job in preparing for that, but they are going to face significant challenges with this COVID demand.
Reports this morning in Los Angeles that they're actually starting to turn people away from hospitals, that they're talking about rationing care. You're describing a situation here where the hospitals can eliminate other things that they do in order to increase their capacity. Do you see us getting to the point where we see something similar to what's happening in other parts of the country, or do you feel like we're going to be able to handle the patient load for the foreseeable future?
Well, we have regular calls, so it's hard for me to speak for the hospitals, but I will tell you what they're saying is they do believe they will be able to meet this demand, but it will require modifications, adjustments. The biggest challenge they have across the country is to get staffing. When you have more needs, you need more staff, and the staff are being consumed pretty much everywhere. So yes, Los Angeles has already gone through all the steps that our hospitals would go through, and they were not enough. Our hospitals are also very aligned. They're regionally based. They have shown that they can work very collaboratively and coordinatedly to weather this storm, but there will be impacts.
Did you have your questions answered, Commissioner?
Yes, thank
you. Yeah. And I'm not sure whose hand went up first, but Commissioner Overman, you're recognized.
Thank you, Chair. I appreciate that. Just trying to connect there. There we go. Dr. Holt, thank you very much. And Mr. Wagner, thank you very much for your reports. Those, as well as Dudley, those are very important information to get out to the public. We did hear from Dr. Michael in December that we would anticipate a surge because so many people were getting together. And the surge that we're starting to see now is really back from Christmas holiday period, not necessarily New Year's. And if you looked at that long graph, you know, before businesses opened it up and before kids started going to school, we had numbers that were manageable. But now we're at 800 a day and lines for testing. And as you know, a surge in the need for testing because people are sick, or at least they believe they're sick and need to be tested. They believe they've been exposed to someone and need to be tested. So it's critically important that the great work that our citizens have done and those businesses that are doing a great job of following through on the mandates continue to do so. It's really, you know, pandemic fatigue is certainly set in. But people are losing their lives. So I do think it's important to pay attention to the hospitals and the resources we have available. The demand for vaccine, as we're going to hear shortly, is largely due to the fact that we know that the virus is out there in massive amounts, and it's very difficult to protect yourself if you don't take the precautions that are recommended by the CDC. I'll stop there, but I do think it's critically important that we continue that message that we will not win this war thinking things are normal. They're not yet. And I look forward to working with our businesses and our local governments as well as our hospitals to try and help us, you know, fight this because we got to do it together. Thank you.
Thank you. Commissioner Hagan, you're recognized.
Thank you, Madam Chair. I'd like to speak after the next section, the vaccine distribution information. I don't have any comments right now, but after the next section, I'd like to speak. Thank you.
Okay, thank you. Okay, and I'm at this point, are we going to Mr. Hordell or Ms. Wise?
Yes, ma'am. Yes, we're going to transition to the vaccine distribution discussion. We know it is top of mind for everybody, for all our citizens, frankly, across the world. And all the counties in Florida, of course, are trying to get the vaccine distributed as quickly as possible. We, of course, have too. We've had some stumbles. We're going to talk about that and talk about our efforts going forward. So with that, I'd like to turn it over to Deputy County Administrator Greg Horwedel.
Thank you, Madam Administrator. Commissioners, Happy New Year. I wish more than anything that I was here to tell you how smoothly everything went with our vaccine rollout. While we did achieve 9,000 appointments, and today started the first day of vaccinations of putting 9,000 doses into 9,000 arms, I know that there were a number of frustrated citizens. Because of the limited amount of vaccine, we tried to make sure that there was going to be a process in place. We had a vendor, and I think the vendor would acknowledge that they did not perform as we expected them. So between the vendor's website that they subcontracted out to another company, that ultimately crashed at a point. They started metering traffic, and that had a domino effect on the number of calls coming into the call center. While on Monday, we did book approximately 7,000 appointments, there were several thousand more, I'm sure, based upon demand for people who did not get through or who got a busy signal or some other error message. And that is not the level of customer service that we're accustomed to providing. So we worked very closely with the vendor. We took a number of steps. I outlined many of those in a assessment report that I sent to you late last night. I apologize it was so late, but it took a while to collate all the data and make sure that we were accurate in what we were saying. So staff did jump in. We recruited 25 county employees. We trained them up first thing on Tuesday morning, put them out at PSOC with a lot of support from information technology staff, communication staff. Really, it was a team effort pulling together. We then, again, made the rest of the appointments throughout the day. So I am happy that we reached the 9,000 mark. I will note that there are a number of items that we need to work with a new vendor. We are doing that now, work with them to make sure that the process is much smoother and that the calls are handled in a way that we expect them to be handled. I can personally say I was disappointed in how the vendor handled the calls the first 2 days. And I know emergency management staff would say the same thing. So we are working toward a better solution. I'm confident that we will have a better solution, and that as we go forward and have more and more weeks of vaccine scheduling and injection, that this process will become much smoother. By way of context, we have approximately 206,000 people 65 and older in Hillsborough County. While not all of them tried to call for a vaccine, at times it seemed that they were all calling. There was a call volume running anywhere from 2,000 to 7,000 calls per minute as people would get a busy signal, hang up, and redial. Unfortunately, that added to the call volume, so it just made it more difficult. So the plan is to have them queue up on hold, which nobody really likes to do, but we think at this point, as long as they know that there's certainty in talking to a person, of course, the messaging will have to be there while they're on the line as well. We'll make sure that that does occur. I also want to note there are a number of things. I don't know how much more detail Tim or Dr. Holt is going to get into, but we do have a number of other programs we're going to roll out. I want to assure you and the citizens of Hillsborough County, we will be reaching out to every corner of the county. We've identified a number of sites where there's a good concentration of folks who are 65 and older. We'll be sending mobile units to those sites, setting up camp for a day or two, and making sure that we get them vaccinated as quickly as possible. Much of this is going to depend, of course, on the supply of vaccine from the state. So we are working closely with our partner, Department of Health. And I can say without reservation that I know Dr. Holt and Ryan Pedigo are working as hard as they can with us to try and stabilize the flow and get folks vaccinated. That's our primary goal. We want that just as much as you do and just as much as the citizens do. We want to make sure that we get everybody of that vulnerable population vaccinated first and then move on to the general population. So I think with that, I will turn it over to Tim. We, of course, will be available for questions. We're not here to sugarcoat anything. We want to tell you what happened. We think it's important that we're transparent. There were problems. While we did reach the 9,000 mark, we can do a better job on the customer service side, and I'm committed to doing it. So with that, Tim?
Thank you, sir.
Before we move on, just for a second, I just like to, there's a lot of hands up. Is it all right with commissioners as we finish this presentation, and then we'll take all the questions?
This is Commissioner Hagan. I'd like to go first, though. When
Commissioner Let's just Hagan, I'd move like to
go
on.
all the speakers are finished. Thank you.
To make sure, I didn't want everybody upset that they weren't allowed to ask them appropriately. So,
Madam Chair, I assure you we will hang around and answer every question.
I'm sure you will. And Mr. Dudley?
Commissioners, good morning again. Thank you for the opportunity to address these issues related to the vaccine appointment system experience this week. As Mr. Hordell and the county administrator has mentioned, this is certainly not up to Hillsborough County level of service that we've come to expect for us. We've been working closely with the vendor, and they understand that our frustrations with the rollout, as well as we understand the frustrations with our citizens. We've identified those problems and we went into troubleshooting mode, and we have courses of action moving forward as described by Mr. Hordell. And the task force, vaccine task force, some of the other things that we'll be doing that was not mentioned. By the end of this week, we'll have 4 sites open. And while we're moving through this first mission, we are taking a look at our next 4 sites that will be opening here throughout the county. We are in constant communications with the state. It's constantly changing and evolving. But Raymond James has been identified as one of the potential regional sites for the state to administer vaccines. We're looking at the capacity of its current configuration right now, whether we can do it on that site or we may look at other sites. But the state will be bringing another 1,000 doses per day, and they're looking at running that opportunity 7 days a week. We will also, for our most vulnerable who can't make it out to our sites, just as we do for COVID testing, we will offer a mobile option. We know that that's critical. And we're going to continue to work with DOH and assess where the best locations to meet our citizens with the most need and making sure we get coverage throughout. The state's been working closely with CVS and Walgreens. They've been handling some of our most vulnerable facilities. So that process is continuing along with our healthcare providers. So we're going to continue to attack this on multiple fronts. We're going to continue to work closely with our information technology teams to ensure that the next solution moving forward meets our expectation and drastically improves the experience. Just wanted to thank the team for moving quickly to ensure that we could meet our goal of 9,000 this week. Sites open up at 8 o'clock this morning, and the sites will continue running. We have extended hours. They'll be running through 8 p.m. this evening and throughout Saturday until we get these vaccines completed.
Thank you. And will we have Dr. Holt present now, Ms. Wise?
Yes.
Yes, Dr. Holt, please.
Yes, ma'am. Again, thanks for Mr. Dudley has reviewed what happened. I'm going to review what we intend to make happen. The Florida Department of Health in Hillsborough County, the health department, our role is to receive and distribute the vaccine that is intended for use in our county. We do that with a partnership with the county government and engaging our medical community. There's only 2 sources of vaccine in the state, the 2 pipelines. They actually all come from the Florida Department of Health in the state via the Florida Department of Emergency Management. The first, what we get locally, that is given to the Hillsborough County health department to use in our geographic county. It can and is allowed to be used by anyone, but we distribute it here in our county. We have received 23,500 doses in 2 weekly allotments starting December 28th. The first week dose was 4,000. We had used 2,000 for our EMS, fire rescue, ambulances, and other frontline vaccinators. Of the remaining 2,000, initially we had 1,500 that was going to go through our drive-through, but at the end of the week, actually over the weekend, Tampa General offered to give us 3,000 for our drive-through. And so that was the remaining 1,500 that was intended for the drive-through has been reallocated to our community partners whose staff signed up to vaccinate their staff, other healthcare workers in the community, and that aren't affiliated with the hospital and their patients. The 19,500 plus the 3,000 that we got from Tampa General is committed right now through to our drive-through. We did have an emergent meeting over the weekend with the county staff who estimated they could vaccinate 9,000 in a weekly manner. That is significantly more than anyone around. We have another 9,000 of that amount that's committed for the following week. If we can again maintain that schedule and capability, and we hope and expect that the amounts will continue to receive weekly will allow us to maintain that pace. But the reality is that it will vary week to week, and we'll have to look at each week ahead what we have. But our goal is to use all we get so that each week we can show that we need more from the state. This same vaccine, as Mr. Hordell said, will be used for mobile strike teams to go into areas that Ms. Wise is going to term targeted vaccination areas or TVAs. Examples of these are any locations where large number of eligible persons over 65 reside. Our senior housing complexes, 36 of which have over 4,000 residents, will be our initial target. And then looking into other retirement communities. We want to continue to expand our medical partnerships as we know the public would prefer to be vaccinated by their doctors. As we receive and supply the state vaccines, we'll continue to report what we get and how we use them. The second source of the vaccine that is comes into the county is directly from the state that goes to hospitals and our partners, the federally qualified health centers, Tampa Family and Suncoast. We do have a meeting with them today to coordinate and unify, or at least join our efforts so we make sure that we are working in collaboration. I intend to have two reports that I'll make available. I'm working with Mr. Wagner on. Very simply, it'll show the number of vaccines that have been administered as recorded in Florida Shots every week, with those that the vaccine local to Hillsborough County has been used, and the rest will be from the other source. We also will show the cumulative numbers of vaccines over time. Ideally, I want to get to 15,000 doses a week through January, and we'll need to double that in February. And that, I don't know if that's achievable, realistic, but that's what I want to accomplish with our partners. I'll stop there.
Thank you. And does that complete our presentation, Ms. Watt?
It does. Thank you.
Thank you. Okay, so there's a lot of commissioners with questions, comments. Commissioner Hagan, you're recognized.
Thank you, Madam Chair. I'll start out by saying I appreciate all the comments, particularly Greg's candor. I want to preface my remarks by saying they are not directed at any particular person. because quite frankly, I do not know who to blame. For me, the only way to adequately characterize the vaccine registration process is that of a clown show. However, it's not amusing when you consider the potential life and death consequences at stake. Candidly, if this occurred in the private sector, someone's ass would be fired. I know staff is working overtime to change vendors and correct the process, and that is very much appreciated. But what we have witnessed the last 2 days is disgraceful and unacceptable. The fact the website crashed almost immediately after it opened was bad enough, but the problem was compounded with confusing messages, mixed messages, and a lack of timely information provided to both our citizens and our offices. We have all seen the emails, so I'm not going to go through them, but I'm beyond frustrated. Our citizens are frustrated, and this process better be drastically improved by our next distribution. And that's all I have to say. Thank you, Madam Chair.
Madam Chair, the commissioners in the boardroom didn't hear you. I can see that you recognized someone.
Oh, yes, you, Commissioner White. Sorry.
Okay, thank you very much. I too have received countless emails to my office. I spoke with Aid on Your Side yesterday. This has shown up on their radar screen, and I just want to echo Commissioner Hagan's sentiments, but I specifically want to focus on the vendor. And if you're a vendor that wants to do business with Hillsborough County, you have to deliver on your promise. This company has promised that they could stand up a system and adequately administer it, and it's been an utter failure. I know that staff, I'm not going to beat a dead horse here. I know that staff has been in constant contact with the vendor and is in the process of holding the vendor accountable. And I just want to just reiterate that I fully support holding this vendor accountable. And I think this is just a great time to talk about vendors that wish to do business with Hillsborough County across the board. We are going to hold our vendors accountable. Thank you.
Thank you. Commissioner Cohen?
Thank you very much. I agree with the statements that were made by the other commissioners, and I don't want to beat a dead horse about what a fiasco the last couple days have been. It's been particularly frustrating for me because I have made an attempt to get information out there to people, and oftentimes the information changes so quickly that I find that I'm not giving clear direction. And one of the things that I promised people was that we would get some information at today's meeting that could help them understand what this process is going to look like going forward. I know we need to improve it, but there's a lot of misinformation out there, and I think it's important to ask this question. In addition to what we're standing up, what are the other opportunities to be vaccinated going to look like? There are private sector providers that are going to be giving vaccines. There are healthcare networks that are going to be giving vaccines. Can we reassure people, particularly those that are over 65, that over the coming weeks, they're going to be able to get vaccines through those sources in addition to what we stand up? I'm not sure who to direct that question to, but I suppose it would be Dr. Holt. Why don't we start with
Yes.
I would guess that would start with me. If we don't have the vaccine, which starts with me, we can't achieve what we're talking about. We've made very clearly getting vaccine out to our local community doctors one of our priorities. So we've partnered with our medical society, several large practices, Judeo-Christian clinics, some others, and they are committed. And so if I can deliver on my end, we'll get that out there. The hospitals also have large outpatient networks that include a significant portion of patients that are over 65 as they're on Medicare that are assigned a medical home. We're going to better quantify that later today. They have indicated they will take that on as their responsibility. But again, that requires vaccine. So, Commissioner, I can't promise what will happen. I can just tell you we're doing all we can to make sure that the vaccine is available is close to their medical home, but for the short term, the state drive-throughs and the county program will be providing the majority of vaccine for at least the next few weeks. I'll stop there.
And if,
for example, I mean, I'm hearing that people are getting appointments for vaccines through Baycare, through some of the county administrator told me about 2 organizations yesterday, Suncoast Health and Tampa Family Health Centers that had vaccine available. You know, you're saying that people are going to eventually, you think, be able to get it from their private provider. But does all that vaccine flow through you, or are there other channels that it goes through?
I wanted to make a clear distinction. The hospitals and the federally qualified, because they're under a federally qualified health center, are allocated by the federally qualified health center. Tampa Families and Suncoast have allotments that are dedicated to them, really all the way from the federal level. The governor has made vaccinations through the hospitals the primary source for the vaccination, and so they've received well over half of the doses to date. But clearly they have a dual role of responding to COVID patients in their hospitals, but they also have a large, Baycare is a great example, USF and Tampa General together have large outpatient complexes. What we've tried to do is join groups like our Florida Physicians Alliances and other large group practices that are either formally or informally aligned, and they commit to standing up a vaccination site for their workers first, because they're the vaccinators, and then schedule all of their patients through that common source, because I can't distribute the vaccine to hundreds of private providers, but I can get it to central hubs that they stand up on their own. But eventually, all of those providers will be available to order the vaccine directly through a system called Florida Shots. But the state needs to have enough vaccine to fill those orders. And right now, they're keeping it under these control for us to do the public, unified, more efficient way of delivering vaccine, because it just is so timely. I'll stop there.
Dr. Holt, though, this is very complicated. It's a very complicated way of talking about this, and what we have got to do is simplify this for people. We have got to put together a fact sheet that says, here are the places that you can expect to get a vaccine appointment, because it's not just us. It's also healthcare providers. You were just talking about hospitals, anybody that's federally qualified. So there are multiple places where vaccines are going to be available, and if people don't know that, it's just going to add to the frustration of overloading our lines. It would be very, very helpful to all of our offices if we could get the information so that when people call and email, we can send them out a sheet that says, here is what to expect in the coming weeks, and here are some ideas of providers that you can either call or reach out to who have vaccine. I mean, just the exception that you mentioned with those that are federally qualified, that's a whole nother group of healthcare providers that have vaccine, and we need to get the information out to people so that they know that they are going to have some options. I'm not going to get into the issue with the vendor and all that, because I am sure we will have plenty of time to talk about that going forward. But I just want to ask one more question, because there's so much confusion about this. What do we actually realistically expect to receive in our allotment over the coming weeks from the state? And what supplemental numbers of vaccine from other sources do you expect will be out there?
Yes, sir. It's a great question. And to your comment, and I'll again compliment the leaders of the hospitals and actually the county administrators in a 4-county. We have a conference call this afternoon at 5 o'clock just to get aligned and have that information that you're talking about. As to how much we expect, that's a central unknown of this. I really wish I could provide a realistic number. If you give me 9,000, give me 19,000 this week, you got to keep giving me that, at least that much, that I can administer second doses to come and to continue to expand. I think they understand that. I don't think they're not giving us all they get, but they're not telling us what to expect. The hospitals and the FQHCs, we do get informed about the federally qualified Tampa Family and Suncoast just awareness of what they have received recently. The hospitals, I have no idea. We will be talking to them later and see what they're willing to share with us. So again, I apologize that I don't have that confidence or certainty of what to expect.
The other commissioners have questions, so I'll stop there. But I just want to reiterate that, we're all very, very concerned about this, and we just have an obligation to our community to make this situation better and smoother and easier in the coming week. Thank you.
And I think, did you still, Mr. Horodale, want to comment to that or no?
Only to echo what Commissioner Cohen had said, that we did provide messaging to the vendor that unfortunately was not loaded. So those are issues that we're addressing with them. We will not be using that vendor for call center anymore. I want to make that perfectly clear. So if you want to term it the firing the vendor, yes, that vendor will not be handling the call center operations any longer. And to Commissioner Hagan's comment about it being a clown show, I frankly share those sentiments. It was the worst performance from a vendor responding to our concerns that I have ever seen. So you're right. We have to do a better job. I'm committed to doing a better job. I know that the emergency management staff is committed to doing a better job, as well as communications. We share your frustration, and we will be working closely with your offices as well as the public to get the information out as soon as we can possibly do that. I want to emphasize that, unfortunately, because of the flow of vaccine from the state, the way the pathway works, Dr. Holt is right. We don't know, we just don't know how many doses on a daily basis are being delivered to Hillsborough County. We've registered that concern with the State Office of Emergency Management, and I believe they're going to migrate to a different system where that information will be available. So we will, of course, include that in our report to you because our interest, just as yours is to get every citizen in Hillsborough County vaccinated, those who want one.
Thank you. I'm going to recognize Commissioner Overman.
Thank you, Chair. I appreciate it, and I do appreciate everyone's reports. And I echo both Commissioner Hagan and Commissioner Cohen's comments. Monday was crazy, and when I've got citizens that are calling me up saying, "Hi, we can help you," because it was so bad. It's a testament to say, that people are going, "Hi, we recognize this is a mammoth project, and you guys clearly need help." So to that respect, I appreciate those that have offered assistance, and I appreciate staff's efforts to try and manage this craziness. I do say that it's critically important that we are on point, moment by moment, communicating to the public what our mission is, how we're doing it, and what we're doing to address where there are challenges. But as Mr. Horodale mentioned, this circumstance is changing every moment. getting more information. Every day we get new information, and that's problematic. We've committed to currently vaccinating the 65 and over as the first stage, as well as our first responders and frontline workers, as an agency or as a collective group. And my office has been contacted by numerous frontline healthcare professionals who don't have access to the vaccine. I'm talking about dentists, doctors, labs, medical offices, home healthcare providers, nurse practitioners. These are folks that are on the front lines, are working in our senior communities and working with our 65-year-olds that are indicating they don't have access or they don't know where they can get access. I've read in places like Orlando that they're sharing allocations, which we've heard Tampa General has chosen to share some of their supply. But if they're going to these small providers, we need to know who those partners are. If we have heard, we have 200,000 65 plus 65-year-olds. But how many of these people that I'm talking about do we have in our county? How many healthcare workers, CNAs, working in our senior centers, how many of those individuals also need vaccinations? We've heard in our survey that we're getting about a 75% response saying, I'll take the vaccine. But if we know that we've got 200,000 initially in this first phase, and say on a rough estimate, I don't know what the number is. How many healthcare professionals, CNAs, doctors' offices, labs, those folks that need to be in contact, close contact with individuals that are exposed with a community spread level that we have now, with individuals, how many of those individuals do we also need to vaccinate? Because 9,000 a week or 1,000 a day or whatever we're getting from the federal program and the others, we're not going to get there anytime in 6 months just for that first phase.
Right.
And that's why it's critically important to know what our goal is and communicate that to the powers to be. Because at the moment, we've gotten these calls, we all know what we were trying to do, and we respect the fact that people are frustrated because they're scared, and I don't blame them, especially if they're very vulnerable. But we also know that people that are healthy without health conditions are dying of this. So it's critically important that the public understands the choices we're making is as a consequence of what the information we're getting from the state. What we get in way of information from the governor is critically important in those agencies that provide us with the pipeline of supply. Clearly, we have no problem with the demand. We've got plenty of demand, but we need to know how many healthcare workers is our target vaccination rate, and how many of those individuals, like our first responders, our firemen, the other municipalities, fire safety, those folks that are in contact with folks, how many of them have been vaccinated? And do we have a plan for making sure that that supply is there for the people who need to have that protection? When do we anticipate and demand that the state give us a pipeline supply number so that we can plan accordingly, so that we're not constantly failing in meeting the expectations of our citizens and taxpayers that are expecting us to be able to provide them with a safety net to not die. And that's important. And then what method are we using for the distribution that may be already there? Some of our community partners or agencies or private enterprises, like our pharmacies, are able to do flu vaccination every year. And are they being fully activated to assist in the COVID vaccination, whichever way it may? And I think that's an important question to get answered. How much is going through those pipelines that, as Commissioner Cohen mentioned, people can tap into to get access to the vaccine if they're over 65? And then what does our second round look like? We've got teachers that are, in our universities that are hanging around kids that were out partying over the holidays that are now in their classrooms. And those individuals are highly at risk because they are in close contact with each other if they're not doing e-learning and they're doing, brick and mortar. So I think it's important that we quantify the number of people that are in each of these phases and then, lobby the state to get us what we need. Because we cannot meet expectations if we don't have that plan. So I want to make sure that we have a written plan that talks about our vaccination plan. So I'd like to, and I appreciate everybody's doing what they're doing. I'm hugely impressed with our staff and everything that's been done, and with Dr. Holt's agency, given the resources he has, which are limited. Mr. Dudley and his team have done marvelous work. But we still are failing to meet the objective. And part of it's because we don't know, one, what the plan is, or the number of people in each one of these phases that we have to attack. And two, we don't have a guideline or a pipeline assured to make sure that we have the vaccines available, especially given that we're starting to see a community spread level that is unmanageable. And that's why I mentioned earlier, it was so critically important that we have people stay on point and follow the CDC guidelines so that we don't have people get infected before they have an opportunity to have a vaccine. So I appreciate the verbal presentation. I move that we receive the written written vaccination plan at the next BOCC meeting on January 21st to be able to be as transparent with our residents as possible so that they know, if our goal is 1,000, if all we're being told by the state is 1,000 a day, and we got 1.4 million people, it's going to be a while for a lot of folks, including those that are at most at risk. And that's why I want to make that motion to receive a written plan for each of those tranches that we've talked about and how much vaccine we have to have and how we plan on working with all the sources of vaccine and all the distribution centers of the vaccine to get it out to the people that live in Hillsborough County. I'll stop there.
So we have a motion by Commissioner Overman. Is this a report that you would expect Dr. Holt to prepare, or I'm just not certain if maybe Mr. Hord?
I think I'll answer that question. I believe it would need to be through Tim Dudley, Mr. Horadell, as well as Dr. Holt to build that plan so that the county can say, based on the mission we've been asked to do by the state or the feds, honestly, because that, in my opinion, is where this should have been managed, but we got it. But I think it's critically important that we tell our public, we've been asked to do this and we're going to do this and this is how we're going to do it. And these are the factors that we have no control over, but we're going to work with it as best as possible. And we're going to put in a request for this amount each week. And when we don't get it, we've done our job as best we can. And I think that's an important thing to provide to our residents. So I'll restate it so it's clear. I move that we receive a written vaccination plan at the January 21 board meeting to be as transparent as possible to our residents of the mission that we're trying to accomplish.
Okay, we have a motion by Commissioner Overman. Is there a
Second.
Okay, we have a second by Commissioner Hagan. And Commissioner Smith, you've been on there for a while, so let's hear from you. And at the same time, before we, because this is just a general discussion, I'd like to just move with what we have and we can talk about this because the report is overall looking at everything. So Commissioner Smith, you're recognized.
I'll wait till the motion on the floor is disposed of. My hand was raised for the general discussion. I'm assuming, as far as the motion on the floor, I'm assuming it, we would be getting a report that addresses everything that Commissioner Cohen was also bringing up, which I know Commissioner Overman said she agreed with. I do too. That in order to get that, and if we can, of course, get much of that information out and available to the public between now and then, that would be the goal as well. I'm assuming that that's kind of the direction that this motion would give. If it's not, correct me, but I'll support the motion, and then you can come back to me for comments.
Okay, I'll recognize and to the report, then we'll just move with that. Commissioner Cohen, do you have comments to make as to a report?
Commissioner Smith just said, I was hoping we'd hear from all the commissioners before and then we can throw everything into the motion, I think, because it sounds like there's obviously a lot of information that people want. I appreciate the reference to some of the questions I asked. I'm assuming Commissioner Smith and Commissioner Myers and the others may have some things to add.
Okay.
If I need to, I will withdraw the motion till all the comments are made and then reposition it with all of the changes that are recommended by the board. And look for a second,
okay,
please.
And maybe we can just move with the discussion then. I'll go back to Commissioner Smith at this time to with your comments, Commissioner Smith.
Thank you. And I agree with everything that all of the commissioners have said before me, from Commissioner Hagan to Commissioner Cohen and Commissioner Overman and Commissioner White, all the remarks. I think this has been an excellent discussion, giving direction to what we need to hear moving forward. And I also want to say that I saw Mr. Dudley on the television news last night, and I just want to say that our staff, I think, has done the best they can in these circumstances. Mr. Dudley did a stellar job representing our county's emergency management department on television news last night. Mr. Horwedel has done a great job giving us a very transparent explanation of where we are and where things stand now in the face of very fast moving, day by day changes in information, changes in the number of doses we're receiving. Making 9,000 appointments in the first 2 days of this rollout, as frustrating as the process has been, the outcome was a success in meeting that goal, especially in that it was accomplished in the face of so many challenges. The last minute changing information, we were told we'd get 1,500 doses. At the end of the day, it was 9,000 doses, and we didn't know that until the very last minute. And then, the biggest problem and the biggest frustration and source of anxiety, I think, in our constituents is the limited supply of vaccines in the face of enormous demand. And that supply is not within our county's control. What has fallen to us suddenly, and I agree with Commissioner Overman that it might have been better handled at levels above the 67 county level here. But what has fallen to us suddenly is to help the state health department with a local appointment setting system. And we have no choice but to contract that out. We do not have a Hillsborough County internal COVID vaccination appointment setting system. The way we do that is to find a vendor quickly, hire a vendor, and based on our discussions and negotiation with them, and work with an outside vendor to do that job. That has been a miserable failure. That appointment setting system is one cog in the wheel. Meanwhile, we've been doing a great job testing people and providing data about this whole coronavirus pandemic situation in our county. So just to provide the context, this one cog in the wheel has failed and failed miserably. But I have confidence that our staff is working long hours and diligently, and I'm glad to hear that we are addressing that with a new vendor, and we have lessons learned to help with the next vendor, insisting that they don't subcontract further out without our control will help. Keeping the idea of keeping people on hold will help assure people that they are in line and keep everyone from further overwhelming the call system by redial. I mean, I think the most frustrating part of this system has been that feeling of our citizens who are having to keep redial, refresh the website, not knowing where they are in the system, and having to spend all day doing this only to find at the end of the day they didn't get the vaccine. And that feeling of frustration is compounded with the high level of desperation our citizens, our seniors, our vulnerable populations are feeling about this life and death situation, with the vaccine being our only hope, our way out at this time. So I've been working with staff on some suggestions for improving that piece of the appointment setting system. And we do need to, rethink some of that as we move forward. I'll ask a question about this system. Several people have suggested that some kind of lottery may work better than trying to get appointments through a website or a call system in a system like, for example, where everybody might sign up online, create an account online, and then the county working with the state health department could reach back out in some kind of first come, first serve way of just giving them appointments. I think one of the things that bogged down this system was kind of a silly layer of complexity in asking people to choose which of the 4 sites they want to go to, which day they want, what time in the day. And by the time you'd checked all those boxes and then gone to fill out another screen of name, address, and everything, your appointment was taken after all, and you had to start over. And it was a needless layer of complexity, since I think 97%, according to our survey, of our seniors and people looking for a vaccine would go anywhere at any time. We tell them, just let them get in line for an appointment and then tell them when and where to show up, and they'll go there. I have friends who've driven to other counties also to get vaccinations this week. And by the way, those other counties aren't doing a better job than us by the reports I'm getting. So it's a quick and changing situation, and I have confidence that we are going to be able to figure out ways to make this easier on people, less frustrating on people who are stretched thin in their coping skills with the year-long pandemic that they've been facing. Some kind of a system like concert tickets use, even if it closes early, at least lets people know where they are, is another suggestion. So, but beyond that, I think maybe even more important is a system of getting the detailed information out that the commissioners are talking about now, so that we all know where we are and we can communicate that directly to our citizens, and everybody has a clear idea of who's in charge of what, and what we can expect next week, and what we hope to expect in the coming weeks. Thank you.
Thank you. And we'll move to Commissioner Myers. You're recognized.
Thank you, Madam Chairman. I won't say I agree with all of the comments. As we all know, anything new that we start, it is some hiccups. And as I shared with our county administrator, Ms. Bonnie Wise, on yesterday, what we witnessed yesterday reminded me of when Obamacare came online some years ago. That system crashed the very first day, and everyone was complaining and all, and he asked us to be patient and call some people up to Washington to help get it fixed. And I say today, we must be patient. This is new for all of us. None of us have experienced the vendor, county staff that has worked so diligently to make this happen. We have 4 sites. That is good. To extend the vaccination from 1,500 to 9,000, that is a plus. What we're talking about is all of the citizens are calling us and complaining that they could not get through. But I ask that we be patient and work through this. As we all know, the state set the guideline, the state of Florida, our governor, okay? And what we're discussing now, we want our county staff to come up with a plan to say how we're gonna move from week to week when we don't know what the governor is going to say or send us. And last night, I noticed Publix was a new vendor that was not around. So it changes so quick, and I know everyone is frustrated. I received calls last night at home about this, and I asked those that have called me personally, be patient. We're going to get through this. Everyone is worried as with COVID-19 and what some people have experienced. But now that we have a vaccine that is in place, we're trying to get it out, and they've identified you have to be 65 and older. There are people that are calling that are under the age of 65, want to know when I'm going to get my vaccine. So as we work through this, I ask county staff to support the board. We're talking all what we need to do and who need to be fired. And I appreciate all the comments as a new commissioner, and I'm not going to always be new. But let's see what the governor is going to tell us what we need to do without rushing to judgment so quickly to come back with a report at next month's meeting when things are changing daily on this COVID-19. And I do agree a fact sheet when we can have additional information, that will be good so that we can say and post everywhere as we've been doing already. Other sites are available, and I think that's it. Thank you so much.
Thank you. And I do not see any other commissioners' hands raised at this time. I do have a few thoughts of this, and thank you, Commissioner Myers, for some looking at it in bringing out some different points, I think, that were raised. And the comments have been, I think, very helpful by all the commissioners and by staff. It has maybe, hopefully, for the public, elucidated the issues, the challenges of all of this. What we're faced here, as what was told at the beginning of the meeting has been reiterated, is a very scary situation here in Hillsborough County. We at one time had our positivity rate down to almost 5%, 6% or so. And right now we're at 15.4%. It's since Thanksgiving. Then it's higher than it's ever been before. Your chance of catching COVID is more serious than it's ever been in Hillsborough County. And I hope everyone continues, everyone who has, and everyone out there realizes this and takes personal precautions. And that means wearing a mask diligently. And that means not going in places that are crowded and full of times to catch the virus, protecting yourself, your family, and the community at large. We've heard our hospitals are near a stress point that other communities are having, like Los Angeles, where they can no longer take people in, where they're setting up tents. I just really want to, we've moved into a hopeful phase. We have to just keep going right now to do everything we can to still bend this curve in our community. And I just don't want to lose that point as we move forward on this, because that is, it's kind of like you can, I don't know, get things to, solar power to use less energy, but doing energy efficiency is one of the best things you can do. So insulating ourselves from catching this and spreading it, I think, is really important. It's been a huge challenge. This would seem, as they're doing in other countries, best managed from the federal level, but that hasn't happened. Next best managed from the state level dispensing this, but it's kind of been up to 67 counties in a way that hasn't been centralized in its distribution. And just to be clear, as commissioners, I think we've all been overwhelmed by the emails, by the text messages on my phones, by the calls, by people saying, this doesn't make any sense, and this has happened and that's happened. We are working, and staff has been working very hard. The vendors that we must hire to do this kind of rollout, yes, we're not what they should have been, but it's a extraordinarily difficult situation. I'd like to be clear. People say it's Hillsborough County's program. Just to be clear, it's a Hillsborough County Health Department. The Hillsborough County Health Department is the health department of the state of Florida with an office in Hillsborough County. And we are, as was pointed out before, very much at the mercy of the supply. And the supply in no way, and this was kind of the opposite of what some people suggested would be true, but the supply in no way is meeting the demand. It's a crushing demand. We have 200,000 people over 65 in Hillsborough County, and we had 9,000 vaccines available this week, and we were supposed to only have 1,500, and we got 9,000. So it's been there's 190,000 people out there perhaps that would have liked to have the vaccine this week. And that's just counting the people over 65 that couldn't get it. 9,000 people have been scheduled for appointments. We were originally only supposed to have vaccines being given on Wednesday and Thursday. It's now been extended to Saturday and Sunday. We would be working, taking phone calls 24 hours a day, 7 days a week, and giving vaccinations too, if we had the vaccines to give. At this time, we're, as has been noted several times, at the mercy of the pipeline that comes. So while I'd also like to see and hope that we see some kind of certainty that's much greater than the certainty we've had at this time, and hopefully that will be coming, and hopefully this will smooth out. I think we do have to realize too that it's a problem of supply and demand, and the supply is not what we would want it to be at this time. With that, I do actually have a question about supply for Dr. Holt, and I don't mean to confuse this more, because I think it's terribly confusing how all this is going out to individual vendors, to hospitals, through the federal government, through the state government, in all these ways. But when we say, so I know Dr. Holt at one point in this conversation said he was hoping to have 15,000 vaccines a week, which would be quite up from what we initially expected this week of 15,000 to keep up. Is that that's correct, Dr. Holt, what you were what you are hoping for Hillsborough County?
Yes, ma'am. And these are based on assumptions. If we can maintain 9,000 a week, if the state does do 1,000 a day at their state site, then we'll be at 16,000. So I actually want to go north of that. If I can find out and coordinate with the hospitals and the Tampa family or others on the coast that have the vaccine from sources that I don't have access to, I can be able to add to that. I'd like to know what their projections are as far as on a weekly dosing that they can administer, and we combine these together so we know. We had this trouble with testing. We really wanted to know how much was going on, where it was going on. I think hopefully we've learned from that. We'll get together and bring that. If the governor, and when it comes, there's actually a source I didn't even mention, which is our long-term care facilities, which is getting it through CVS and another contractor at the state level. So I'd like to keep an eye on that. I want to count for all the vaccine that's being administered in this county. We'll see a total that the state reports. What I'd like to know is kind of where are the systems, where is it flowing? Because that feeds the information that the public needs to go as to where they go.
So my other question is about this. If we're talking about 15,000 a week, and we'll start having, after 3 weeks of vaccinations, we'll have to do a second. And I assume within short order after the 3 weeks, or we will want to give people the full security. Is that part of like, if we get 15,000 in the 4th week, are we going to have to use those for the 9,000 that we just did, and then 6,000 new ones? Is that accurate, or are we getting 15,000 plus 15,000 or 9,000 second vaccinations, or how's that to ensure people have second shots? I would just like to understand that a little bit.
Yes, ma'am. Very insightful, and the board is again showing how educated you are in these topics. Correct. The 15,000, my target, and again, I put myself at risk by giving a number, but I got to create some expectations. That is for January. We would need to double that to continue that beyond February, because you need to begin doing second doses of who you've done and adding new doses for the first time. So we start with how many new people can you vaccinate over time, regularly and sustainable. And 3 to 4 weeks later, you got to double that basically. The federal government has told us, and through the state, they're not releasing to the state 50% of what they have to ensure there's a second dose when it's needed. You've probably read in the countries in the world are thinking about modifying that, but the United States is sticking with getting the second dose. So that's kind of the problem, is that we may get a lot of vaccine a month from now, but quite a bit of it may have to go for the second dose, and I can't maintain the first doses. But again, what I can commit to you is full transparency. You'll know the information, and you'll know what we're doing, and that's, I'm doing the best we can.
Okay. Other countries, every country but the U.S., have their national healthcare systems that I think have provided a natural place and distribution, apparently, from what I can understand, for the vaccines. We're in this situation here, and it's come down to the county level, and the county level is acting as an assister to the state to try to help citizens of Hillsborough County to do our best for the vaccines that we do have. And I guess hopefully we will get more information. This is just something I would like the public to understand, about how this works, and that we will hopefully be getting more vaccines and be able to distribute more vaccines, because even if it were 15,000 a week, it would take a fair amount of months for us just to get the people in Hillsborough County, the 200,000 people over 65, to have administered the vaccine too. So it'll be quite a challenge. I hope that we can speed up. I hope every place in the country and the state of Florida can speed up, and that the availability of the vaccine, it will become more available, and we can, do better on the phone calls, the signups, work on that. Our biggest constraint, and I think everyone should know that, it's the availability of the vaccine at this time. And we will be working as we go forward, but we ask that, please stay safe and do everything you can to keep your family safe during this time. Let's all make it through this. I think it's important too, as we move forward with every commissioner is getting all kinds of email and all kinds of information. And so I appreciate Commissioner Overman with regards to the report. I also think it's important that we have a uniform statement that's put out between all the commissioners, that we all are not doing our own individual responses to this, so that we can let the public know that are writing us or contacting us the same information from all the commissioners, not different stories, because we're talking about getting a message to the public that's clear and unequivocal, and doing everything we can in terms of transparency at the county level, and doing everything we can to let the public know what's going on and how they can best, get in line for the vaccine at this time. And that is all I have to say, but I see that Commissioner Cohen has his hand raised.
Thank you, Madam Chair. And I actually wanted to speak so that I could speak to Commissioner Overman as she makes her motion. But I do appreciate everybody's really good comments, particularly Commissioner Myers, reminding us to all be patient. Commissioner Kemp, to your statement about putting out consistent information, that is why I would like for part of this motion to include for the staff to be providing us continually with updated communication information, not just about our own vaccine rollout program, but what we find out about others in the community that are offering the vaccine as well. If we hear that Publix is starting to roll out, or CVS or Walgreens or other private providers, it would be wonderful for us to be able to communicate that directly to people and even give a phone number or a website. Or if we hear that if you're part of the Baycare network, you can call this number to sign up. If you're part of this network, you can call this number. That's, I think, going to be very, very helpful in letting people understand what their options are. I think a lot of the frustration, people understand that we don't have enough supply. They just don't want to be sitting on the phone calling needlessly all day long if there aren't appointments available and if there may be other avenues for them to get the vaccine. So to your point, if we could get some consolidated information that's easy to access, I think we would all be able to communicate the same information out and have a unified message. And I just wanted to suggest to Commissioner Overman when she makes her motion to please include that. Thank you.
Thank you. And Commissioner Overman, you're recognized. I see there's, and maybe they want to make it to the motion. There's still another commissioner who wants to comment, but Commissioner Overman, you're recognized.
Well, thank you. I'll wait till Commissioner White makes his comment before it, because he may make something that would allow the motion to be done without amendments and all the other things that go along with making motions. So,
And Commissioner White, you're recognized.
My comment actually is not to the motion that's about to be put on the floor, and I'll make it brief. If this board takes an action and communication staff puts out a message about it, that's standard protocol anyway. But I just want to say for the record, though, that for my individual responses as a commissioner to my constituents, I would like for that to remain within my office and within my staff, and I'll certainly let staff know if I need any information or technical assistance as we're communicating with them.
Overman, you're recognized.
Thank you, Chair. Okay, so I will make slight adjustments to the request for a written vaccination plan. With that is more about what our target is, what we have to do. So, we saw several weeks ago, and I'll explain where I'm going here with this. We saw several weeks ago a vaccination set of slides that said, these are the first group of people, this is the second group of people, this is the third group of people. What we don't know is in that first tranche, this is how many people there are. We don't know. Although I have heard now that we have over 200,000 seniors at 15,000 a week, that's 13 weeks before the first tranche is even touched, not including the first responders, the healthcare workers, the CNAs, the at-home, caregivers, those individuals that are the dentists, the lab workers, all those individuals that are on the front line, our sheriffs and or not our sheriffs, but our first responders or fire rescue. We have given a lot of vaccines. So a lot of those folks have been vaccinated, but we don't know, one, how many have, and how many more do we have to do. Two, we also don't know what are our sources of vaccine to communicate well. To Commissioner White and Cohen and Myers' points is, where do people go in the event that they don't necessarily want to take the state provided or they're eligible for a different source? So the reason I would like to recommend a written plan to come back to this board, and it doesn't mean don't do anything until then, but come back to this board on January 21st, is to identify not only the goal in each of these phase outs that we are attempting to meet what the county and the health department and our emergency team and our staff and our communications team are all attempting to achieve. What does that look like? And how many folks do we have to vaccinate in each of those various different tranches so that we can develop a communications plan that says we've hit 10% of that goal or 50% of that goal? Because right now, as we've all discussed today, there's coming in from everywhere and a lack of understanding of the goal. So we do know that we have, if we've heard correctly, that Dr. Holt's goal is 15,000 a week. Our seniors that are 200,000 folks now, if without any other information, now know that it's going to be 13 weeks before we're going to get there. So go back to my original motion. I move that we receive a written vaccination plan that includes hitting the goals, identifying our known sources and those sources we could in fact partner with, and a communications plan on how we're going to make sure the public is aware of where they can find access to vaccinations at the next meeting so that we're able to be as transparent and informative as possible with our residents.
Okay, we have a motion by Commissioner Overman. Do we have a second?
Second.
Okay, we have a second by Commissioner Smith. And at this point, I would like to recognize Mr. Horadell, who I think might have some thoughts to share about all this.
Yes, thank you, Madam Chair. Just very briefly, I won't belabor all the points that have been made. You all have had almost exactly verbatim the same conversations that we're having in emergency management and with Dr. Holt and his staff at DOH. I can assure you that we will provide you whatever information you wish. There are plans that have been written, and we'll make sure that you get that in as timely a manner as possible, hopefully yet this week. So we're working as hard as we can to make sure that we roll out as quickly as we can. It's really been an unprecedented event. And I'm not here clearly to make excuses. I wish that the actions of the vendor didn't reflect on all the good work that county staff has done, but unfortunately, that's the case sometimes. So we're going to work harder, we're going to be smarter, and we're going to do a better job of it. You have my assurance, and I'm confident that we will end up in a better place. Thank you for your comments.
Thank you. And I do not see Commissioner Overman's hand is up, but I think that's remaining from before.
Yes.
Other than that, I don't see any other hands up at this time. So we will, no further discussion on the motion. So can we have a roll call vote?
Kemp? Kemp?
Yes.
Overman? Overman?
Yes. Yes.
Smith? Smith?
Yes.
Cohen?
Yes.
Hagan?
Yes.
Myers?
Yes.
White?
Yes.
Motion carried 7-0.
Ms. Wise.
This item in this particular matter is the county attorney update for the extension of the emergency order.
Yes, good morning, Commissioners. Order in your backup that would extend the local state of emergency for an additional 7 days, which is the amount that's allowed by Florida law. I would note that the governor recently did extend the state's state of emergency. They can do it on 60-day increments, and that was done towards the end of December. And we did provide a draft in the backup, and at this time, Madam Chair, it would be appropriate to entertain a motion relative to that order.
Motion by, okay, Commissioner Overman, seconded by Commissioner Smith. And Commissioner Overman, your hand is up. I think you're muted.
I'd like to speak after this motion is disposed of, please. Thank you.
Okay, thank you. So seeing no further comments, please take a roll call vote.
Kemp?
Yes.
Overman?
Yes.
Smith?
Yes.
Cohen?
Yes.
Hagan? Myers?
Yes.
White?
No.
Motion carried 6-1. Commissioner White voted no.
And Commissioner Overman, did you want to speak now?
Yes, please. Yes, please. Thank you very much. I'm not going to sugarcoat this. Our COVID-19 numbers that we heard earlier are frightening. Our positivity numbers over 15%, our hospitalization cases and cases per day are continuously rising. And lastly, our case of 110 cases were the highest have been seen since the pandemic was announced. As we saw the pictures of holiday revelers going about their lives as if there wasn't a care in the world to be concerned about, it has come for time for us to actually consider decisive actions. And I'm not going to ask us to vote on this today, but I think it's important for us to recognize we have tools in our toolbox that we need to consider. With that in mind, I will be asking for stepped up enforcement measures and the creation of legal options for possible future board approval. First, I want to thank our law enforcement and our code enforcement officers for their effort. This is not always easy work. Matter of fact, it's very tough work, especially when people are out having a great time. But, and you don't want to be a party pooper, and we certainly don't want to hurt our businesses. But they know full well that we have bad actors in our community who are repeatedly violating our mask order and social distancing orders. And those bad actors have made a business decision that they'd rather disregard our public health efforts and pay our fine, which are as low as $150, and max out at $500. From the discussions with legal, we have many options to issue multiple citations for separate violations orders. So for example, a business owner who's required to enforce our ordinance and has to maintain that people within their business are seated while served or wear a mask when they're inside their business, and they don't, if they get one cite because they've been notified, that they make that up in an hour of business. But if there are 25 people in their location, employees and or customers that are not wearing a mask, that's 25 violations. If our fine is only $150 times 25, that's a violation that someone might actually choose to make better decisions about helping us fight this fight of community spread. So hopefully this heightened per person, per incident enforcement will incentivize our bad actors to be valuable partners, like the vast majority of the businesses within our county that are helping us with this fight. Ms. Wise has been told, I've been told that this does not require board action, as our current order permits this approach. Hopefully we can implement this in haste, because it's critically important, as we've seen, that those individuals who are not playing by the rules understand the financial consequences they will meet should they not help be part of the solution. Secondarily, we do have more tools in our toolbox, and I'm asking the board to support the county attorneys drafting amendments to our orders. The first would be to extend our mask requirements to include any outside area where a bar or restaurant is permitted to serve or sell alcohol or food. Because those areas have been expanded to help businesses with their capacity, but they're not wearing masks while they're out, they're not seated while they're served, there's still a lot of exposure out there. Also, it should be clear that a bar and a restaurant staff must wear masks while they're working inside or outside. So I think we need to, ramp up our ordinance to include that circumstance. The second draft order is to consider closing bars, nightclubs, and any establishment which is permitted for on-premise sales consumption of alcohol at either 10, 11, or 12. 10 p.m. seems to be a number that's been proposed in other counties. We need to look at that, and I'd look for the board's input, but to eliminate alcohol sales after a certain hour would be appropriate. With our numbers worsening every day, we have to do something to limit super spreader events and to stop large alcohol-fueled gatherings that are occurring in our county. The draft language is to be provided to the full board in advance of our next board meeting, giving members time to review it and be ready for a vote. I don't make these decisions lightly. I know this, I don't want to hurt our businesses. And those businesses that serve food, that provide food to our shift workers after, say, 10 or 11 o'clock, will still be able to operate because they're not serving alcohol. But I think it's critically important that we use measures that where we've seen abuses to this circumstance and creating super spreader events, that we look for ways that we can mitigate the community spread. Thus, I move we direct county attorney's office to draft 2 orders or amendments to our current orders for the review at the January 21st board meeting. The first is to extend our mask requirements to include any outside area where a bar or restaurant is permitted to serve alcohol or food. And second, to close an establishment that are selling alcohol for on-site consumption at 10 p.m. And I'll stop there. That's a combined motion.
Okay, we have a motion by Commissioner Overman. Do we have a second?
This is just to bring back the language to consider.
Do we have a second?
Commissioner Overman?
Yes, ma'am. I can do that if that would be preferred. So the first motion, excuse me, the first motion is to draft a mask requirements to include any outside area where a bar or restaurant is permitted to serve or sell alcohol and food. So that's my first motion.
I'll second that one.
Okay, we have a second on the first motion. Is there a second on the second motion as to on-premise sales ending at 10, 11, or midnight, just or ending on-premise alcohol sales? Is that?
Okay, can we dispose of the first motion and then address
Yes.
the second motion? Because I have a feeling if we voted on them together, we wouldn't achieve the goal that we're trying to accomplish.
Right. Okay, that sounds fine.
Thank you.
So is there, Commissioner White, you're recognized.
I just want to say for the record that I'm going to be voting against this. On a lot of these political initiatives that many of which expand beyond COVID, quite frankly, people always like to say, follow the science, look at the science. And my understanding is that the science indicates that that the spread is much less likely in an outdoor scenario. So I just, on public policy grounds, following the science, I just can't support it.
Commissioner Myers, you're recognized.
Thank you, Madam Chairman. At our last board meeting, we just voted for wearing the mask at the restaurants and all. And I was wondering, Commissioner Overman, if you would consider where we have an excellent staff with our code department, allowing them to have the opportunity to work with the various businesses and ask them in advance, as patrons come to their restaurants or nightclubs and all, to ask them while they're being seated outside, would they put their masks on? Let's give them the opportunity first before we put another ordinance in place and work with our partners, which is the community and the businesses, before we take action on this today. I think our Code Enforcement Department under our wonderful county administrator leadership can get this done. And let's give this a try first before we put another ordinance in place. Thank you so much.
Commissioner Cohen, you're recognized.
Yeah, I basically feel the same way as Commissioner Myers. I would be willing to support drawing up the language on this. That's fine. I don't know how I feel about actually doing it or not. I do think it might be better to try to go for some voluntary compliance first on this. But I'm willing to look at it. I just am not. I'm not sure where I'm going to come out at the end of the day. I don't think that this is. It's wearing a mask outside is a bit of a different question, I think, than inside, and I'm going to need some time to think about it.
Commissioner Hagan, you're recognized.
Thank you, Madam Chair. I too have concerns. Many of our small businesses have been crushed and are barely surviving. I'm concerned these additional measures, frankly, will be the death knell for many of them. So I'm going to be unable to support either motion.
Smith, you're recognized.
Thank you. And Commissioner Cohen is exactly right that this motion is simply to begin drafting language to bring back for board consideration. I am not sure I would support whatever is brought back, but I do support us looking at, discussing all the full gamut of the things that were mentioned by Commissioner Overman, as well as, you know, other things other commissioners might think of. And I think it's important to, you know, begin providing a message to our county and our constituents that we are looking at solutions. We may not adopt this measure that's on the floor right now of mass in outdoor situations at our next board meeting, but we will continue discussing, and I commend Commissioner Overman for the political courage it takes to advance this conversation that is very controversial in our community. But at the same time, I mean, there's plenty of people on all sides of this. Some are noisier than others, but at the same time, recognizing, as Commissioner Kemp did earlier, what the data that we've been shown today, that our case numbers are higher than ever, that our positivity rate here in Hillsborough County is among the highest in the state at 15.4%. And our meetings are only every 2 weeks. So if we don't, you know, begin discussing things to be brought back and consider, we might get far behind before our ICUs are overloaded and we have, you know, refrigerator trucks outside our hospitals. So we really need to stay on top of this curve and continue looking at all possible solutions that might be needed from time to time, and can be, keep in mind, repealed as we go when numbers come down. As far as mass outdoors, I mean, if you're hiking with people in an ELAP preserve and you're 6 to 10 feet apart, no, you don't need masks. But if you're gathering on our say the boardwalk at Lettuce Lake Park in numbers that prevent in crowded situations that prevent social distancing, if you're at a concert out in an outdoor venue, or drinking in an outdoor venue where the people are packed together for an hour at a time, that might warrant mask wearing. And so maybe we can craft, if needed, if we come back and decide we are willing to look at something else, we might, you know, get specific about the numbers of people and the kinds of situations where we would consider looking at masks. Again, I am not, by supporting the motion on the floor today, I'm not committed to supporting what comes back 2 weeks from now, but I am committed to continue looking at solutions and be ready to put in place whatever measures we can to bring our numbers down and make our citizens safer, and have that have those tools ready for us as needed, keeping in mind when our numbers come down, we can repeal them as needed as well. So thank you, Commissioner Overman, and I will be supporting this motion.
Thank you, Commissioner Overman.
Thank you very much. And I do want to, like I said, I want to bring back language that the board can consider. But I do want to address a couple of comments that were made. There is absolutely nothing political about this move. This is addressing the fact that our numbers prior to opening businesses and prior to opening our bars and restaurants were manageable. They were manageable. We could provide the vaccines, we could provide the healthcare, we could provide a lot of things, and people could actually operate, go to work, and function well when our numbers were low. We are not at that anymore. This is, you know, when I know I have friends that got together with a cousin they hadn't seen in a long time just before the holidays, and went out to a restaurant that had an outdoor service, had a beer, had a dinner, and those two individuals that were in an outdoor environment where they were seated, they chose to seat and be served, and still acquired COVID, and no one else in their environment, in their world, got it. Being seated while served isn't a silver bullet, but it does help. And we need those that are blatantly violating the CDC guidelines within a business, or in a business environment, to recognize that there are penalties that have to be faced. I too don't want to hurt our small businesses. I don't. But it is important that we have a perspective on how we best address the fact that our community spread is beyond our control at this point. And one of the ways that we can manage it is by putting one or both of these measures in place. And this isn't, this fight that we're fighting isn't brand new. We've been doing this, and the business owners have known what majority of our rules have been for well over 6 months. It's not like they don't know that their employees are supposed to be wearing masks. It's not like they don't know that people that come into their businesses are required to wear masks. And the only real significant change we've made was just before the holidays, where we asked people to be seated while served. And we find that we have businesses that are blatantly violating the rule or just don't care and are willing to pay whatever the fine is. And that is not the way you respond in a public health emergency. So I do want to see our businesses succeed. We have, I don't know the number. I know that the city's keeping track of it as well as the county. How many businesses have signed up for Safe and Sound that have adopted these types of practices in order to make sure that they know that their employees and their customers are safe? So they've chosen to celebrate that they are being part of the solution. And with these items to be considered the next time, many of these items are things they're already doing, and they're being successful at keeping their employees safe and keeping their customers safe. So I would appreciate the support of the motions to bring back language to consider by the full board at the next meeting. I'll stop there.
Thank you. Commissioner White, you're recognized.
Thank you. I just want to say briefly that I didn't mean any disrespect when I referred to political decisions. Everything we do is political. By definition, this board is a political body. And I just want to say to those of you that are thinking about supporting the motion today, but you're not so sure you're going to support it when it comes back. Yeah, I just want to say that our staff has been working double time since the arrival of this pandemic back in March. It takes an awful lot of work on staff's part to put something like this together. And if it's just ultimately going to get voted down, it's just really an unnecessary stress on them. I mean, we've already asked for this written report just a few minutes ago. That's going to take an incredible amount of work. So, I would just urge everyone as you're thinking about, how you're going to vote and decisions to be, respectful of our staff's time and what a precious resource they are. Thank you.
Thank you. And I don't see any other comments. I would just like to, as well, recognize Commissioner Overman. I do think in this environment, it takes courage to be the one to make a motion. I know that you've been really tracking all of the COVID, the very scary COVID spikes that are happening right here in Hillsborough County. And as we noted earlier, a 15.4% positivity rate rising over the last 7 days, over the last 14 days. It is just, I think about since Thanksgiving. We've just seen it there. And the one thing we know about COVID is the more you have, the more you get. It's not easy to bring down. It seems very easy to rise and very difficult to bring down. I also, and I think, anything we can do to put out the message that we're taking this very seriously and reminding people of the danger of the spread. And like you, I mean, it just breaks my heart, as I think it does every commissioner here and so many people in our community, to see our businesses so devastated by this. But they'll be more devastated by deaths in their families, and perhaps we don't even know the lifelong effects of this, or what happens in our communities, our overwhelmed hospitals. I think about our healthcare workers and, the stories we've heard from across the country of how difficult it is to hold a hand or just be there for the person in their final moments of life who can't talk to their family members, but by a screen, and just the burden that they're carrying is a significant burden as well in this community. So I again support. I'll be supporting the motion. But the other thing I think is well noted is Commissioner Smith's in terms of the 2 week. We don't have another meeting for 2 weeks. In 2 weeks, we could be very regretful, and we could just pass it without discussion, without community note, without notice. In terms of the specifics, as you said, people are well on notice for the last 6 months about maybe what we need in businesses as well. But the fact that we're bringing this up and moving it forward, so we have it to look at in 2 weeks, because I'm very afraid, frankly, of what we're going to be witnessing in 2 weeks. So in terms of that, I certainly support. I appreciate the discussion, certainly support considering, whatever it may be in 2 weeks to perhaps, even if it's just giving a stronger message about, how we need to stay safe during this initial period till we can get out those much demanded vaccines that we don't have available yet. I'll be supporting this. So I don't see any further discussion, and seeing none, we will do a roll call vote. That was a motion by Commissioner Overman, seconded by Commissioner Smith, by the way.
Kemp?
Yes.
Overman?
Yes.
Smith?
Yes.
Cohen?
Yes.
Hagan?
No.
Myers?
No.
White?
No.
Motion carried 4-3. Commissioners Hagan, Myers, and White voted no.
Thank you. And Commissioner Overman, did you want to move forward with anything else at this time?
Well, there were 2 motions. Did that cover both?
No, just the first.
Okay.
We separated out the first about in terms of, as you asked to do.
Right.
Okay.
And then the second motion is thank you, to be recognized. The second motion would be to consider closing the establishments that sell alcohol on site for on-site consumption at 10 p.m.
Okay, and so we have a second motion. This would be to draft something up for then the next meeting. And do we have a second?
That is correct. To draft an ordinance for consideration to consider closing establishments that sell alcohol for on-site consumption at 10 p.m.
Right. And do we have a second to Commissioner Overman's motion? Second? Okay. Yes, Commissioner Smith. I'm sorry, Commissioner Cohen, you're recognized.
If there's not a second, I don't have to talk.
Commissioner Smith?
Yes, I just want to say that although I am not supporting this motion at this time, I don't think there is board support for it at this time, but I want to say I am open. I am open to such a measure at a future date if need be, hoping that we keep all our discussion open to all different kinds of solutions. So my not seconding that motion today doesn't mean I would never consider a tighter curfew on certain things if that would help.
Thank you. I appreciate that. Just to address the issue associated with staff has done the research on this to determine what outstanding cases are out there. Currently, there is a federal case that might cause this some problems. The goal is that should be disposed by the 21st, hopefully. And if that were, then it would be at that point we would consider it. But that, again, this is just to draft the language in the event that we find ourselves in a situation where, you know, our exposure numbers are looking in the 20% level, and we feel it's necessary to actually respond accordingly. As we, you know, are in our high season period, we want to make sure that our not only our residents, but also the tourists that come see us are safe. And I'll stop there.
Thank you. Okay, I do not see a second. So at this point, I don't see any further comments. Yes, Commissioner Smith. You're muted. Commissioner Smith, you're muted.
Right. Quick question for our attorney. Being that this is an emergency situation, are we free to consider even something like a 10 p.m., 11 p.m. Curfew on bars, as is being done in other counties? Are we free to consider that kind of a change to our ordinance as we, you know, review that ordinance at each time at our next meeting, whether or not we've signaled that we're doing that ahead of time?
Yes, Commissioner, given the state of emergency, it would be permissible. You have had an informal policy as a board to have things drafted and brought back so that all commissioners have time to properly assimilate and study and research, you know, their position on it. But it would not be legally prohibited. But I did want to just follow up briefly to also say that the particular issue of the curfew is a very fluid one. There was a 3rd District Court of Appeal case in the state of Florida that did allow Miami having a curfew, but on December 23rd, Broward County issued a similar curfew requiring closure from midnight to 5 a.m. and that was challenged in federal court, and a temporary restraining order was issued against Broward, and that is what is on appeal right now to the 11th Circuit Court of Appeal in Atlanta. So the issue, while yes, you can consider it, it is somewhat in a state of legal flux right now.
And speaking about, you know, anything, not just a curfew, but any other measures we might want to take as far as enforcement or whatever, I fully agree that it's best practice and best policy to, you know, inform the public and each other as far in advance as we can of things that are being considered. But that might also be accomplished by a board member putting an agenda item on as a commissioner item for a board meeting. Correct?
Yes, Commissioner, and even if it was brought up at the actual, you know, meeting, it would be legally allowable.
Commissioner Cohen?
I wasn't going to speak to this, but since there's been some discussion, I'm sure that Commissioner Overman's purpose in bringing this up is partially a response to the absolutely outrageous pictures that we saw from New Year's Eve. And unfortunately, all of the incidents, at least that I saw, happened inside the city of Tampa. The city has the ability to revoke the wet zoning of properties that violate these ordinances. And my understanding is that the mayor put out a statement this morning saying that they are going to begin the process of doing that. I think that that is a very appropriate enforcement mechanism because it will punish the bad actors and not punish the many law-abiding businesses that are out there who we don't want to hurt any more than the pandemic has already hurt them. I do think the fact that we're having this discussion, though, is good because it puts everybody on notice, as Commissioner Smith just said, that we are not satisfied with the way that these ordinances are being followed. And I do think that we need to keep discussing it. I just think on this one, there is a better way to target very narrowly the bad actors while preventing law-abiding businesses from being hurt. And I think that that's a better way to go about getting to hopefully the same result. I also think the benefit of 2 weeks will give us a sense of just how robust the city's enforcement program really is going to be. I was told directly by the mayor last night about a lot of the things that they're going to be doing. They feel as though they've been on an educational campaign in terms of how they're dealing with a lot of these businesses. And my understanding is that that's over and that it is now going to be a situation where there are going to be multiple citations issued and actions taken when the law is being breached. So let's see how it goes. And we can always revisit this and anything else in the future, having sensitivity to the economic consequences of our decisions. Thank you.
Okay. And seeing no further discussion, and those were, I think to have this discussion was extremely valuable. And again, it serves as notice, and I do think, as Commissioner Cohen stated, to see the city, the photos from Ybor of what occurred that night, and I don't look forward to what we see in the next couple weeks, on top of the spike that we already have. And we need to make sure that we need to do something that this situation doesn't continue. And Commissioner Overman, and then maybe we can move on.
Yeah, and that's what I wanted to wrap up is we do realize that the next meeting to address any of these issues is about a week before the Super Bowl. So if we're concerned about what we saw over the holidays, we do need to, I think, signal to business owners, yes, we want you open for business, but however, please don't add to the mammoth cost of people's lives and our management of the coronavirus response, whether it be testing and or vaccines. Please don't add to the problem that we have that's at this point getting to a point where it's unmanageable. And we need your help. And I appreciate the mayor of Tampa's efforts. I know, and all of the code enforcement folks that are now going to go out and make sure that people understand multiple citations will be issued. And I appreciate the time and discussion today. Thank you.
Thank you. Ms. Wise.
I am cognizant of the time, and I think we were just planning on a morning session, but I wanted to check with board members. We can run through item G1 very quickly, and then we have F2, which is the MOSI item. Did you all want to take a break for lunch or proceed? Proceed. Yeah, that's fine. Okay, very good. Okay. Item G1 is to receive a report on the COVID-19 programs and activities. Tom Fessler will give this report very, very briefly.
Good morning, Commissioners. Tom Fessler, Interim Chief Financial Administrator. I will, when I'm going through the report, today, just to hit the areas where there have been changes in the report since the last meeting. Here we go. Just again, to go back to tracking our expenditures, we are, as of the end of the year, we were at close to $218 million expended out of 256. The way that the original legislation was drafted, we have to incur $256 million in expenditures before the end of the year to be able to not have to return any funds. We have incurred or committed to, or we have expenditures within that fiscal year that will allow us to do that. Having said that, the new legislation that just came out did extend the time frame to spend the dollars through 12/30 of 2021. So we will be trying to wrap up the CARES Act programs that we have in place within the next couple of months. We also are working on a document that we will be able to use. We're calling it kind of our COVID in brief document that we will be able to show how we have expended the funds and the benefit that we've received from them. Very quickly, I'll run through. This is information you've already seen that's in prior reports. So the new information basically relates to an overview of the relief bill that was enacted at the end of calendar year 2020. There were some changes. There was some clarification regarding small business loans. There were obviously, as you're aware, additional stimulus checks, some changes to unemployment benefits that extended those benefits for an additional 11 weeks. A few other items that aren't necessarily related to dollars that the county is going to receive. We have included in the legislation is $8 billion for distribution of the vaccine. About $4.5 million of that in the bill is slated for use and benefit by states and local governments. We're not exactly sure how that rolls out and how those dollars will be distributed. We are keeping in touch with how that, when that may occur. There are some additional testing related expenditures that are being funded. And then some other items that you can see as far as research, some healthcare reimbursement, mental health services, child care assistance. And then down at the bottom there, the moratorium on evictions has been extended through the end of January. Then we get to the piece that is actually related to the dollars that will be coming through to Hillsborough County. So $24 billion of the new bill is related to rental and utility assistance. These will end up being, there will end up being some direct payments to local governments that will go through the Treasury once again. We should be receiving, Hillsborough County should be receiving a direct payment from the U.S. Treasury, where they are required to distribute those payments within 30 days of the effective date of the legislation, which was December 27th. So before January 27th, we should have a direct payment in hands within Hillsborough County. There are some, as you can see here, some guidelines that have been set up for the rental assistance program regarding, incomes associated with it. Is to benefit incomes that are 80% of area median incomes. And then also the payments that will be made are required to go through landlords and utility companies as opposed to actually going to individuals. And then finally, there will be, let's see, next slide. Finally, down at the bottom, the last bullet there, I'd like to just point out that we are in the process of coordinating meetings with the clerk of the circuit court, chief judge, and the sheriff's office regarding potential foreclosure and eviction actions to see how our county programs will fit into the already existing processes. And with that, I'm available for any questions.
Commissioner Overman, you're recognized. Commissioner Overman, did you have your hand up from before?
I did. I apologize. I'll take it down.
Okay. Are there any other questions and by any other commissioners? Seeing none. Do we need a a motion to accept that report?
Second.
Okay. Thank
Second.
you. Okay. So, and I'm sorry, who made the motion? I heard Commissioner Overman second. Who?
It was, Commissioner White made the motion and Commissioner Myers seconded it.
Okay, thank you for clarifying. I really couldn't hear very much at all there. Yes. So we have a motion by Commissioner White, seconded by Commissioner Myers to accept the report, and seeing no further discussion, please take a roll call vote.
Kemp? Kemp?
Yes.
Overman? Overman?
Yes.
Smith? Smith?
Yes.
Cohen?
Yes.
Hagan?
Yes.
Myers?
Yes.
White?
Yes.
Motion carried 7-0.
Ms. Wise.
Next item is item E2, which is a special appearance regarding MOSI. Julian MacKenzie is on the line but had a medical procedure, so he won't be providing the report. But Rob Lamke, Chief Operating Officer, and Brett Feldman, Board Chair, are here for this item. Before they get started, if I could just have Tom Fessler briefly give you a little bit of background on MOSI, and then we will move into the presentation.
Bonnie. Excuse me, Madam Chair. I'm going to have to leave in about 30 minutes, so I'm not sure if there's any action that's going to be asked or required. So just want everyone to know to be mindful that we're going to lose an in-person quorum in about 30 minutes. Thank you.
Commissioners, yes, MOSI is coming to the board today to make a presentation regarding their operating activities. One thing that we did want to make clear up front is they will be requesting some board action today. They are going to be requesting that the board allow them to utilize a reserve account that has been set up for their benefit, and to also modify the repayment terms as it relates to that reserve account. Back in 2009, the county established a reserve account for the benefit of MOSI. The purpose of that account was to kind of smooth out their cash flow needs throughout the year, because MOSI is a seasonal, does have seasonal operations. So there are periods during the year when cash flow is a little bit lower than others. So the reserve account has been effectively operating as like a line of credit. And so under the terms of the agreement, the way that it works is MOSI can request to the county to borrow from the funds, and then they, under the terms of the agreement, are required to make repayments on that reserve within 12 months. At the current point in time today, the reserve balance stands at about $800,000. MOSI again will be coming to the board today to request to utilize that reserve. Due to the pandemic and some other operational challenges, they're going to be requesting to use the reserve, but not to repay it within 12 months. But when they are projecting to return to a point in time where they have cash flow to be able to repay the funds, which is, you'll see in their presentation, a couple of years out. Just wanted to also highlight the fact that the county does provide on an annual basis operating support to MOSI. That operating support currently is $624,000 a year. It's for their general operations. That represents just under 25% of the revenues that MOSI is currently generating. In addition to that, the county also has within its budget, within our facilities department, a budget for maintenance activities at the MOSI site, which generally has been averaging about $200,000 a year. And with that, I will turn it over to Brett Feldman, who is the MOSI chair, and then to Rob Lamke for the presentation.
And thank you, Mr. Fessler, and thank you, commissioners. Happy New Year to all. My name is Brett Feldman. I am a partner with the law firm of Phelps Dunbar, and I'm current board chair for the Tampa Museum of Science and Industry. I just want to give a brief preface to the presentation that Rob Lamke will make on behalf of MOSI. I've been a volunteer with MOSI for about 15 years. I've seen MOSI go through some financial ups and downs. I joined MOSI's board about 5 years ago. Since joining MOSI's board as a board member, my focus and the focus of the rest of the board has been on financial stability for MOSI. The current MOSI board has made many changes to MOSI. Some of these changes have been difficult, but our goal has remained to keep that financial stability for MOSI while maintaining its mission of STEM and STEAM education for the greater Tampa Bay area. And in that mission, we were successful in right-sizing MOSI and bringing MOSI's finances into the black over the last few years. But as I know you are all well aware, having sat through the last few hours of discussion, COVID has impacted MOSI much like it has impacted many charitable institutions, and in particular museums. MOSI was shut down for several months last year during its peak season. Its attendance has been halved since reopening. And on behalf of the board, we are continuing to look for ways to maintain MOSI's mission of STEM and STEAM education, given COVID's impact. We've pivoted to more outreach. We have more online education, but that doesn't solve the immediate financial needs. And one of the ways we have discussed is to utilize these county reserve funds.
I'm sorry. I think we've lost Mr. Feldman.
Mr. Feldman, it looks like you're having an internet connection issue. I'm not sure if you can hear us, but you could try turning off your camera. That will sometimes help. It looks like he might still be having an issue. I'm not sure if his internet may have
Okay,
completely...
maybe we can get him back and just move forward with Mr. Lamke.
I'm prepared to move forward if that would be of the liking of the board.
Sure, why don't we do that? And then if we can get Mr. Feldman back on, or he could also, if staff gives him information to finish his presentation by phone.
Excellent. All right. Well, first off, thank you, Madam Administrator Wise, Madam Chair Kemp, and County Commissioners for agreeing to hear us today. As has already been alerted to you by Mr. Fessler and Mr. Feldman, we are here in an attempt to make a presentation for us to be able to use the county reserve that has been designated for MOSI. So I will go ahead at this point and share my screen. As it's already been narrated, we are here today requesting board approval. The board approval would give us the ability to use our county reserve. By using that county reserve, we are able to sustain our operations through 2021 as the acknowledged premier resource in the Tampa Bay community for science, technology, and innovation. And as Mr. Fessler had stated, to make amend to the terms of replenishment to the county reserve. As Mr. Feldman was in the process of talking about, there were some grave financial and operating times for MOSI, as some of you on the board were on the commission board were well aware of, as you were a part of that board at the time. Moving into August of 2017, MOSI closed for a period of time in an attempt to restructure and renovate the facility to see if there would be any opportunity to make this community landmark sustainable. We renovated, we restructured the organization, many difficult decisions were made. At that point in time, I came on board in July of 2017. And we, with a lot of incredible teamwork from the staff here at MOSI, were able to open our doors again in November of 2017. To say at that point in time we were a lean operating machine would be an understatement. We were incredibly lean with many, many individuals doing multiple roles, but the camaraderie and teamwork was definitely what pulled us through to a very successful opening. Since 2017, there has been, 70,000 field trips connected to MOSI. We have had over 55,000 students participate in our outreach programs. Over 100,000 students have participated in multiple levels of programs at MOSI, either on-site or off-site. We took the initiative in making sure that multiple demographics would be reached in this new MOSI era. And that included creating STEAM as well as STEM education. An art wall was implemented to show the connection between art and science as it relates to our community. Again, opening up to a different demographic for us. We reached a young adult audience, which had never been reached before, with events such as Science After Dark, themed activities for young adults to keep them engaged with science, with technology, and with innovation, and most importantly, with the venue. The other thing that we were able to continue after 2017 is the proud host of the Hillsborough County Schools Science Olympics, conducted in partnership with Tampa Bay STEM Networks. The impact of MOSI in many ways is not measurable. But there are many ways to measure MOSI as far as what its impact has been in the Tampa Bay community. STEM production, STEM degrees are the hot topic now of science, technology, engineering, and math. And the one thing that we can all be proud of is that the Tampa Bay community has consistently been a leader when it comes to STEM education, specifically STEM degree production. We've actually been at a higher STEM degree production rate than other comparable markets. We are in the evaluation, we're actually tied with Minneapolis in regards to STEM degree production. And the city of Minneapolis has what in some circles in the Aztec community might be considered the premier science center in the United States, or at least one of them. But what's interesting in that is that in a 20-city comparable market statistical analysis, Tampa only ranks 17th in the mid to senior executive positions within the STEM community. Shockingly, right here in our backyards of Orlando and Jacksonville, they're outpacing us. And so what does that tell us? That tells us that the community needs a thriving science center in order for it to maintain not only the STEM degree production, but to keep the talent here by becoming an incubator for technology and innovation businesses, companies, and efforts within our community. And just simply stated, it's start early and keep local. So back in February, when we kind of do the pre-COVID timeline, MOSI embarked on establishing a strategic plan. And in hindsight, it couldn't have been a more perfect time. And the reason it was perfect is even going into a pandemic, it was allowing us to problem solve as we moved along, addressing issues in real time, and in many points, not in theory. It was a catalyst for us in changing how our programming looked, changing what programs we offered. So in part of our strategic plan, we also launched a new mission. And that mission, and I'm not going to read all of these for you, they're very text heavy, but basically was that this was going to be the intersection for science, technology, and innovation, and that this would be the hub, and that our vision for MOSI in this community was that we are the thought leader. When you thought of science, technology, and innovation, there was only one thought. It started at MOSI, it happened at MOSI. And the strategic plan that we have implementing and that we continue to execute even as of today really is going to ensure that MOSI is a sustainable entity in the Tampa Bay community, making the Tampa Bay community everything that it can be with a thriving science center. Just to give you a glimpse of where MOSI has gone in these unprecedented times is I'm not sure that there is another venue, at least science center within this country, who has been as nimble and has had the ability to pivot in the way that your MOSI has. You see a lot of logos on the screen right now. This is all programming that has been created since March 2020 of this year. And the majority of this programming was our calling as a resource in this community to be the ongoing resource for science, technology, innovation, STEAM, and STEM content. A lot of these programs helped with at-home learning. A lot of these programs brought MOSI from an experiment or from a program basis to the home or to the classroom. We addressed it in how do we continue to engage our Tampa Bay community if they can't come and be here physically? How do we create virtual programming, but also understanding that with the state being open and us being an attraction venue, that it has to balance with what our exhibits are and how our on-site exhibits function as well. The undertaking of this from our education team and from our operations team in implementing and executing this many programs is just exceptional, and we couldn't be more proud of the team. So, you know, the unavoidable topic in the room, the impact of COVID has, as no one is more well aware than the group that I'm addressing, has been astounding. The unfortunate nature of this is that the COVID-19 virus has crippled in many ways the museum community and the attraction community in such a way where MOSI had multiple years since 2017 of a record of sustainability and of stability, more importantly, since 2017. In fact, right up until February of 2020. Camps were growing, programs were growing, our attendance was continuing to grow. Everything was on track. And it just, in just being transparent, it took a global pandemic to slow MOSI down. Financially, some projections. You can see where we were at with a $1.2 million loss in 2016, showing some great, you know, revenue achievements and again, stability and sustainability within the years 17 through 19. And then, of course, the undeniable impact that COVID had on the institution financially. You can see where we finished in fiscal year 20, which was a $925,000 deficit. We are projecting at this point in time $725,000. And then you can see where we see from using some benchmarks that we have within our own industry and specifically within our own venue, that we see things improving. Now, albeit slowly, it's undeniable that things are improving. And we forecast, looking into fiscal year 23, that would be the projected year that we would again get above break even to the tune of $13,730. Again, in fiscal year 23, that is our projection. So just to reiterate, Mr. Fessler did it very concisely. You know, the county reserve of 1.2 million was established in 2005. There was an approval to reduce that amount by 800,000 in 2017. And that the use of the money that we are asking for today is for the continued mission that MOSI has in this community of providing inspiration, innovation, science, technology, education, programs, and, you know, fun. Let's not forget fun into our Tampa Bay community as it relates to connecting with science. And then again, you know, just to reiterate again, some of the messages, impact of COVID has been significant. I think way more than any of us ever anticipated, at least in the attraction industry from back in March. We do see a slow recovery to pre-COVID-19 activity levels. And again, the presentation today is purely a request for approval to draw onto the county reserve that was designated for MOSI. And again, to amend the terms of repayment until at such time MOSI is in a positive cash flow situation. And with that, I just, again, can't thank you enough for your time and for your consideration onto this matter.
Thank you. And do we have Mr. Feldman back on the line or anywhere at this time?
I am not seeing him, Commissioner.
Okay.
And
Okay. So does that? Yes.
Sorry.
Go ahead.
I'm just looking at my phone, and Brett had messaged that his system cut out towards the end, so it's apparent that he may not be able to get back on.
Okay. Okay. So does that conclude the presentation here for?
As a pinch hitter today for the presentation, that at this point in time is all that I would have to present. But I am available for questions and to any of the best capacity that I can answer questions of any commissioners. I'd be glad to do so.
Okay, I I'm going to make some statements as the board member who is on MOSI's board, the commissioner who's the board member on MOSI's board, and I did that because a year ago, because I was very interested in MOSI and have been for some decades as in the community. But before I do that, I just have a one question. The request is for $400,000 through this fiscal year. Is that correct?
This is Julian MacKenzie. Sorry, I'm having trouble talking. Yes, I believe that is to be correct.
And the fiscal year is through June?
It's September.
September. And then do you need that? Is it $400,000 just to make the budget that you have now, or do you need or is there a lesser amount in any way that and maybe I could ask this to I know Tom Fessler is on the finance committee. Will this sustain MOSI as projected through September?
Yes, I believe that to be the case.
And could you sustain with less? I'd like to have that answered by both you and Mr. Fessler.
Commissioner Kemp, I do not believe that that would be possible. We've kind of tried to limit the budget down to the bone.
Okay, and does Mr. Fessler have any comments with regards to that?
Commissioner Kemp, I believe on some documentation that I have seen and cash flow projections, I believe it looked to me like that MOSI's intent was to draw down about $300,000 by the end of September. Those what I was seeing was showing a balance in the reserve fund of about $500 at the end of September.
Okay. Okay. So before we go on further, I'd just like to state this. So one of the things that hasn't been discussed, but just a year ago, when I became a member of the MOSI board, I was at the time fully expecting that that MOSI had intended or was slated to move downtown, although I wasn't sure of the status of that. It is very clear, and I think it's a time for the community, and anyone can correct me if they want to. But I have heard no information to the contrary, and all information asserting the fact that MOSI, for the time being, will stay in its place where it has been since the 80s on Fowler Avenue in the building that it's in. That is what we're looking at for the future. And I bring this up because I think that MOSI has had a kind of, in some ways, a very difficult time. It got, a perfect storm. COVID hit on top of, I think, what was, from what I can understand, a lot of people expected MOSI to thrive and kind of get started in a different location. And that didn't happen. And I think it's very difficult to kind of turn things around or work on things under those circumstances. So I think we have to look at kind of a new circumstances here. But basically, when I found out that MOSI was not moving, but there had been some discussion that was with me about the fact that maybe we wouldn't have such a museum, and I totally panicked. And one of the first things I did is look at the Tampa Bay Partnership's 20 Competitive Cities report. And I looked at every single city on that report, and where we ranked 20th out of the 20 cities for transit. But every single city in that report, every single metro area had a robust, thriving museum, from what I could tell. From conversations, I went online, I looked up all kinds of information about their programs, I found out everything I could. Those cities included Portland, Austin, Minneapolis, as Mr. Lamke said, South Florida, Orlando, Charlotte, and these museums were, or science centers, were all thriving and doing very, very well. And I was trying to, I first like to say, I think it is extraordinarily important, particularly in this day and age. If we didn't have MOSI, we should start MOSI. And it's too precious and too wonderful an asset for us to not have in this community. And so I'm on board to do everything that we possibly can. And I think the public is very much on board too, but has not been really aware of the situation as it is now. Or as it was even just before COVID hit. In terms of when COVID hit, yes, all of our museums, all of our, all of our, the aquarium, the History Museum, the Tampa Theater, the Straws, these places were all devastated, as well as we know, many of our restaurants and businesses and others. But it's been particularly devastating on facilities like MOSI, and MOSI is very tied in with our schools. So again, it's been another huge issue for MOSI. I was trying to find out more information about MOSI's finances, budget, historical basis for that. I know there's been a lot of information about that. And I only just in the last week went over the museum management report of the study that was done in 2014. I included it for commissioners on your in the board agenda just the other day. And some of the things I found very heartening, actually. MOSI is had one of the strongest earned income of any of the museums of their size, and science museums in the country. They were doing extraordinarily well in that. I know the county has been a great source of support, more than in other places. The county has really helped and underwritten a lot of expenses for MOSI, but I will say that their earned income was far above what many other similar communities did under that report. Also, the federal and state funding was way lower for MOSI than it has been in other science museums around. The county dollars being the difference and being very supportive of MOSI's efforts. There was one area where MOSI has seemed to have great difficulty in the past, and it's an area that it must change in the future. And that's our philanthropic and foundational dollars that MOSI has, never really been able to, or has achieved getting a good endowment to support the operations and continued viability and thriving of the museum where it is now. And so that is one of the things, but I we think we need to do everything here to kind of start to breathe back life into MOSI and make MOSI the great and wonderful asset and institution that it has been in this community for so many years. And coincidentally, on Monday, the Tampa Bay Times had a story with regards to in Pinellas, the Science Center there, which I guess was closed in 2011 and slated to be torn down. And as many of us maybe know, bought by Career Source. And that is now, they just announced on Monday, is not going to happen. There's this huge community effort now apparently underway, supported by Senator Roussan, who may even be the senator that MOSI the district is in, to restart the Science Center in Pinellas County after being dormant for, it seems like 9 years. I'm not sure what their circumstances were beyond the article, because of its importance and significance for STEM education, for community, as a community asset, that they produced, PhDs that said the most important influences on their life were the Science Center in Pinellas. And that seems to have been very true as well for MOSI. So with that, I'd like to actually hand over the gavel because I'll do a motion at this point. And what I'd like to do is provide MOSI with the $400,000 requested through the fiscal year at this time. And I'd as well, when I saw the museum management study, I thought it was one of the strongest. I thought it was a very good analysis, very, very good. And I'd like the county, and I talked to county staff about this. It's one of the better studies and assessments I've seen. As I said, I hadn't got to study it as much as I would have liked to, but I'd like the county to contact the museum management, MMC it's called, and I'd like to direct staff to update and get an approximate cost for that update, not to exceed 100,000, and direct staff to identify appropriate funding sources for this effort and to report back to the board in 30 days. So that's a motion to go for the $400,000 and to come back in 30 days to try to get this company, MMC, to come back and do the study, this consultants to do the study. It's a very strong, good report. And I'd like to see if we can move forward under some of the recommendations they made at that time to go and build a strong MOSI, which will need lots of help in these COVID times to come back.
Acting Chair at the moment. Thank you, Commissioner Kemp, for your motion. Do we have a second?
I'll second.
We have a second by Commissioner Smith. I see Commissioner White's hand was up prior to. And
Yes, and I'll make this brief because I think we're going to lose a physical quorum in about 2 minutes. I'm just going to say that MOSI has to become self-sufficient. The plans and projections that I've seen are not satisfactory to me. I'm not going to support this. If this motion were to fail, I'd be willing to provide a lifeline to the tune of maybe $200,000 to MOSI to give them some time to bring a better plan back to county staff, but I can't support the motion.
Commissioner Myers, you're recognized.
Thank you, Madam Vice Chair. I do agree with Commissioner White at an amount of $250,000, but they need to show the county that they can be self-sustaining. And that is not shown in the documents that they have provided to us. Thank you.
Commissioner Cohen, you're recognized.
Yes, very briefly, because I'm sensitive to the commissioner's earlier statement about the time. I'm very concerned about this. I recognize that we have to extend the lifeline now, but this museum is going to have to become financially self-sufficient or we're just not going to be able to continue to do this. The demands that are going to be made on us going forward by many of our cultural institutions are going to be enormous. And, there's just going to be a limit to how much we can do. I will support it today, but I can tell you flat out that because I don't believe there's really any choice today, or it would close tomorrow, but this is going to be it if we cannot find a way forward that is self-sustaining.
Thank you. And I actually was going to make a comment prior to this, and then I'll move the motion to vote. One thing is telling for me is that the county has provided $624,000 annually, which is just under 25% of the total revenue, significant, and more than 14% of it in 2014. I know MOSI, along with other nonprofits, got hit with a triple whammy. We had tax law changes, we had different circumstances. We had COVID. Now we have a school district that is strapped, and we are too. And in addition to that, we provide $200,000 a year to maintain the facilities. That's a lot of money without a plan. And I know that you have a plan, but not a financial plan that I'm comfortable endorsing at this point. I need to see how MOSI plans on partnering with corporations that are invested in science and industry in order to have them help us be successful in offering this resource. And I haven't seen that. So with that, I'll ask for that the report that Commissioner Kemp has asked for be a sustainable business model, financial business model, in addition to the programming, because programming is clearly wonderful. I love MOSI. I so want museums. I grew up with museums. I love museums. And I love the science and industry approach. But I also know you've got to have a sustainable financial plan. And we have not seen one with MOSI in years. So that plan or that model that would be a report that needs to be put together with county staff support needs to show the intent of creating a well-documented five-year strategic financial plan that we can invest in that allows this organization to thrive. Otherwise, the reserves are just being used to string along an organization that is going to fail ultimately. And I need to see that in order to support this motion. I'll stop there. Any other comments? I still see Commissioner White's hand raised and Commissioner Myers' hands, and I don't know who raised them first.
I put mine back up, Madam Vice Chair. I move to amend the dollar amount to $250,000.
Second.
So we'll dispose of the amendment first and then move to the original motion. Any comment? See, we have a roll call vote on the amendment of $250,000.
Kemp?
No.
Overman?
Yes.
No.
Cohen?
Yes.
Hagan?
Yes.
Myers?
No.
White?
Yes.
Motion carried 4-3. Chair Kemp and Commissioner Smith and Myers voted no.
Okay, and then back to the original motion. Commissioner Kemp, could you restate your motion, please?
Dollars, as well as to ask to direct staff. And by the way, the study did more or less, it wasn't exactly a business plan, but included a much more focus on that, to determine the appropriate scope of and update, to contact MMC to determine the appropriate scope and update and appropriate cost for an update not to exceed $100,000, and direct staff to identify appropriate funding sources for this effort and report back to the board in 30 days.
Excellent. Commissioner Kemp made the motion. Commissioner Smith seconded it. I see Commissioner Myers' hand raised. Do you have a comment regarding the motion?
Not this motion, but the motion before. I was intending to vote yes on the motion before.
That will be noted.
You could do a motion. You could do a motion. Somebody could. Somebody could do a motion to reconsider to allow her to correct her vote.
the motion to allow her to correct her vote? Either yes or no?
Thank you all.
I'm sorry, I couldn't hear what.
It is a huge problem that the people on the phone cannot hear the people in the room.
Yeah. I have a question for Ms. Beck. I mean, is it that Commissioner Myers has just corrected her vote with the clerk's office? Or do we need the whole motion to reconsider?
I think in this circumstance, if you want to just state that and have the clerk acknowledge it, then that would be appropriate.
Okay. Mr. Clerk, would you please acknowledge my vote of yes? Thank you.
Yes, ma'am. Ma'am.
And with that, did the amendment pass?
The vote now shows 5-2 with Chair Kemp and Commissioner Smith voting no.
Thank you very much. And to the original motion, any other comments? Commissioner Myers, I'm going to assume that that relates to the prior motion. Thank you very much. And please take a roll call vote.
Kemp? Kemp?
Yes.
Overman? Overman?
Yes.
Smith?
Yes.
Cohen?
Yes.
Hagan?
Yes.
Myers?
Yes.
White?
Yes.
Motion carried 7-0.
Thank you all. Chair, the floor is yours.
Thank you. And I'll go back to Ms. Wise. It looks like we have nothing more at this time.
We just have future discussion items, and we have lost our quorum.
Open it up. Are there any future discussion items?
Commissioner Kemp, I do have one.
Sure. Commissioner Overman, you're recognized.
Thank you very much. As many of our residents have faced evictions due to the economic fallout this pandemic, I'd like to ask our county administration and county attorney's office, in consultation with appropriate agencies, to bring back to the February 3rd BOCC meeting a renter's bill of right for the county. Bill of rights to a county. I think it's important that we have a discussion about a renter's situation, especially given what's been going on. I know our other communities have taken a similar action, and many renters may not know their rights under the law, and such as the Florida Residential Landlord Tenant Act or the Federal Fair Housing Act. And having a discussion of the Bill of Rights for our county will clarify both for landlords and for tenants what the terms of agreement are and allow them to be able to work effectively together in order to avoid the homelessness that we're experiencing in our county. So if we could bring that back on the February 3rd, I'd appreciate it.
Thank you. Okay, and Commissioner Cohen, you're recognized.
Yes, thank you, Madam Chair. I just wanted to point something out because I think those of you that are on the phone are not aware of it. But the three of you that are appearing virtually cannot hear and see us when we raise our hands, and we try to get your attention sometimes, and it's clear that you can't hear what we're saying. So the reason I'm saying this on the record is because I don't think you're aware of it, and we've got to get it fixed. Because I keep looking around me, and people are trying to be recognized at all sorts of points through the meeting and having difficulty. And it's I think it has to do with the audio, quite frankly. I think that for some reason, you're not hearing when we turn our microphones on. Because people will try to get your attention, and it's clear you're not hearing it. And it's all of the people that are appearing remotely are, I think, actually not hearing us in the room. So I just wanted to bring this up. We really need to get this fixed.
Appreciate that. So we have that on the record. I would just like to say, of course, that anyone who's raised their hand, so I think there has been a lot of recognition, at least for people to speak when they've raised their hands, and we've had a lot of discussion. So I'm assuming it's probably on the on moving motions and seconds, more that fast clip that you hear. But I think that that's point well taken, Commissioner Cohen. Commissioner Smith?
Just to add that I believe it's not that we don't hear, it's that there's a little delay. There's like
Right.
a less than 1 second, but significant delay in the video. So I don't know if that if tech can try to address that in any way.
That she can see our hands, but there are times when people in the room are talking and it's clear you can't hear anything we're saying. So, and I'm seeing a lot of nodding. So.
Can I offer an observation as well, please? I think part of it is those of us that are online see the speaker and not the people in the room. So that's one challenge. And then two, the audio that we're utilizing is that which is in our computer. It's picking it up, the mic right off the video, rather than the microphones that are in the room. So I would, for future, basically it's a future issue that I'm sure HTV team and communications team can solve. But I think it's the crossover between the mics in the room versus the mics on your computers that allow you to participate in this virtual circumstance. And I'm sure our communications folks can probably help us that. But thank you for bringing it to our attention. And that's clearly hesitating and raising your hands is critically important in order to help us function well. And we want to make sure everyone in the room is actually, whether they're virtual room or physical room, are recognized. I'll stop here.
And I'm sorry for board members' frustrations. And hopefully we can address that. And seeing no other comments by anyone for future items, we will stand adjourned.
Thanks, everybody.
We'll see you at.
Have a good afternoon.
Happy New Year. Hey, Chris. You still there?